All right, good evening, everyone. At 6 p.m., this meeting of the Mountain View Wisman School Board will now be called to order. We will start with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We will now take a roll call of trustees.
Laura Blakely.
Laura Berman.
Chris Chain.
Wheeler.
Devin Conley. Let the record reflect that all 5 trustees are present. We will now move on to approval of the agenda. Are there any trustee comments regarding the agenda? Okay, seeing as there are none, we will go to public comment. If you're a member of the public and you would like to comment on the agenda, you can raise your hand in Zoom or press *9 on your phone. Seeing as there are no public comments, is there a motion from trustees?
Moved.
Second.
All those in favor?
Aye.
Aye. Any opposed? On a motion made by trustee Wheeler and seconded by trustee Berman, the agenda was approved unanimously. We will now begin item 2A, the COVID safety protocols and testing presentation with Dr. Rudolph.
You're on mute.
You're muted, Dr. Rudolph.
I've already completed the whole presentation. It's all done. Staff wanted to talk today about both COVID-19 as well as air quality. We'll start with COVID-19. We do have on hand with us our engineers as well as our construction management firm, who can also answer more technical questions when it comes into to the HVAC systems, just for people's clarification. All right, so obviously the foundational guidance that's been set forth by California Department of Public Health, as well as Santa Clara County Department of Public Health, is that we want to make sure that all students have a safe access to in-person instruction, and really as much face-to-face instruction as possible. Recent evidence obviously shows that in-person can occur with minimal physical distance requirements when other mitigation strategies are implemented. Obviously, vaccinations, universal masking, targeted quarantine practices, as well as a robust COVID-19 testing program. I'm going to be discussing some of our strategies for these. All right, so let's talk about our safety measures. So first, just to look at the number of cases as reported. As you can see, we are starting to see an uptick in terms of the number of cases that we're experiencing within the county. You can also see that the shift in the county, if we were to look at this a little bit over a year ago, you would notice that the shift has moved towards a younger demographic in terms of the cases. But what has not changed is that Latinos tend to experience COVID-19 at a higher rate than other groups. This is the number of beds that are actually available within the county. So as you can see, there's a decline in the number of beds from earlier this summer or earlier last year. And so we're now down, at least when this was pulled, 56 available beds. And so it fluctuates from time to time, but obviously it's definitely something that we want to keep in mind. And then when we start to look at the case for unvaccinated case rate is 32.9%. The fully vaccinated case rate is 9.4, and this is when it was last pulled. The information is updated weekly. So I believe tomorrow will be the next set of updated numbers. So now we want to look at sort of what is the case rate, and as you can see, similar to last year, it's the number of cases in Mountain View, especially in the center city, exceed those to our neighboring districts, Los Altos, in the back, Cupertino, Palo Alto, then obviously Sunnyvale's here. If you pull out a little bit, we're not where the darker blue represents the more cases. So we have one area that is coming closer to a higher area, but is almost at the edge of the district's boundaries. It's right past, I believe that's 237. And then you have pretty much the center part of the city being where the highest number of cases are. We went a little bit further though this time, now that there's more data. And so luckily the census that just came out. And so we're now able to look at the areas, the city, based off of census data or census tracts. And so you can see sort of the Shoreline West area is where a majority of the cases are. It's also where especially on the other side of Shoreline, is where you're seeing a higher density, and then part of Castro City. But, sort of this whole surrounding area is where we're seeing a series of cases. If we were to look at the cumulative testing rate, so how many people are getting tested, one thing that is really good in Mountain View is that you see we have pretty good penetration for testing. There's obviously two areas of concern. One, these two census tracts near Castro and Castro City are areas where testing isn't as prevalent. This is also where the city is starting, the community center is where they were performing testing. So it's not an issue about access. It's obviously an issue about just the number of people who are taking tests. If we were to look at a positivity rate, what you can see is, again, the darker the color, the higher the positivity rate. And you can see right in between, sort of in the heart of Old Mountain View to Shoreline West over the Castro City, is sort of where the highest area is for positivity. Now we want to look at the percentage of students or the percentage of residents. Again, we're looking at census tracts who have at least taken one dose. So we're looking at 12 and older. And what you can see is that the highest vaccination rates in our area actually occur in the southern part of the city. And then you start to see a little bit more over by sort of the Wagon Wheel area, as well as part of Old Mountain View. But the same area that we just highlighted in terms of testing in Castro City is also where some of the lowest vaccination rates. Then, of course, sort of this industrial area at I wouldn't say it's a part of Mauna Loma, but it's definitely headed over in that area. Now we want to look at just the number of individuals who are vaccinated, and we're looking at age group. We're unable to really break this down by different groups, but we were able to pull some new information real quick. So I want to show this. So if we think of residents who are 12 and older, or 16 and older, which is the lowest we could go, who have actually received one dose or more, we can see is that 69.6% of the county's population has actually been vaccinated, with 126,000 who are estimated who are not vaccinated. If we look at whites, we see the exact same thing, around 69.3%, so a little bit lower than Latino vaccination rates, but the number of residents who are not vaccinated is actually higher at 174,000. If we look at Asians, this is kind of interesting. The estimated percent of vaccination is about 95%. The reason why I say it's a little interesting is that the estimated residents who are not vaccinated is at 0. And so, but there's a difference between the estimated total population versus number of residents who are vaccinated. And then if we look at African Americans, the largest subgroup that we have, you will see it is similar to what white and Latino residents are. It's about 67%, but only 12,000 individuals within the community who have not been vaccinated. This is now a look at the number of cases based off of the variant. As you can see, the Delta variant, and it has 4 different strands, is the highest, represents the highest number of cases. Lambda variant, which I've talked about, has popped up in our area a little bit. So we now have 5 cases that are in the area. So now we want to look at staff vaccination rates. So we broke out the information a little bit differently this time. Now on the website, we list the classified versus certificated so that you can see the difference. So 98% of all certificated staff in the district are vaccinated. And then for classified, we are at 86%. Now, this number also reflects individuals who have not submitted their paperwork just yet, are individuals who are not fully vaccinated. So we have some individuals who have recently got a vaccination, but because they're not fully vaccinated, they still count as unvaccinated. So now we want to talk about safety measures. So obviously we are requiring masks both indoors as well as outdoors. We're one of the few districts to do that. We now see there's a movement from other districts to move in that manner. Our students are allowed to be exempted for medical conditions. However, they must wear a non-restrictive alternative mask, such as a face shield, as well as a drape. And we need information from a doctor. We can't just take that on someone's tolerance is just slow. We are practicing physical distancing as per the Santa Clara County Department of Public Health guidelines, as well as CDE and CDC. And one thing that they do bring out, so schools is a little bit different than the general public. So they recommend 3 feet between students and 6 feet between adults and students. And we'll talk about this a little bit more. For the most part, with the exception of during lunch, we have everyone masked, which is also helping to reduce the physical distance. We also have desk shields. So students are spaced 3 feet apart where possible. In some cases, depending on the class, it is a little bit larger. There's been a lot of speculation as to whether or not the desk shields prevent airflow. These desk shields are pretty thin. They reflect, it'd be no different than if you put up a folder. In fact, probably a science fair poster board is a little bit thicker than these barriers. But we do have barriers in front offices, libraries, and it's a reminder for social distancing. It also assures that in the event that mask falls down a little bit, it does provide a barrier. And then the other thing I want to point out, and we'll be talking about this a little bit, due to the high air exchange rates in our HVAC system, it does not impede ventilation. For ventilation, and this is also why we have our team here, just because we know that there's going to be some questions. So all of our campus have MERV 13 filters. Our goal, we are currently adding portable HEPA filters to every single space. And then we also are maximizing external air intake. We use an OK to reopen screener that was reviewed daily, principals review for staff, and secretaries review for all students. So this comes from the Harvard School of Public Health, the Cham School of Public Health. And so the target for them, so one of the things they talk about is just looking at the total air changes per hour. They have 2 different reports that have been included. One is about healthy buildings and healthy schools as a reflection of COVID. The other one deals with just how do you measure the airflow. The ideal amount of air changes per hour is 6, and currently our HVAC system is functioning around 7.4. I'm not going to go deep into this. I think this is for individuals who continue to ask about what is the amount of the airflow rate cubic feet per meter. If there are more specific questions, our HVAC team is in there. They're more, or the engineers as well as the construction management's there. You're more than welcome to ask some questions, but for the most part, because we have a brand new system, I don't think filtration or ventilation is something that we should be worried about. Also, cleaning is a big strategy for us. We continue to daily clean. We have sanitizing protocols. The classroom is sanitized every night with misters. We also do the door handles, the faucets, tables, and tops. We have wireless soap, paper towel, and sanitation dispensers. We also have those. The main offices are hit and the restrooms are hit. So all of our high traffic areas are also included. For lunch, for the most part, we arrange eating outdoors as much as possible. There's a balance between how many seats we can actually put outside. And I think principals have been doing a great job of looking at their current situations and making the best that they can. In some cases, you see a hybrid of people eating indoors and outdoors. In other places, they're eating exclusively outdoors. And in some cases, there are schools that have to eat indoors just because providing the amount of physical social distancing is not always feasible. We did include, and we will post on the website, maps to see what happens if you were to put tables out for every single kid so that they can eat lunch. One of the downfalls of this is that the first one is it has an impact on our fire drills in terms of how the distancing that we have. Another impact that it would have is that it would essentially eat up most of the play field. And so there's just a balance. We do have a couple ideas of how we can get more outdoor air into our MERs, which are used for eating. Obviously between fans, we've also talked about the possibility of adding retrofitting or adding garage doors to the building that are 10 feet wide that can roll up, that will allow for more outside air. And I know we're going to be discussing this if possible, but I think the principals are doing a great job of understanding that the goal is to get as many kids outside as possible, while at the same time trying to maximize the amount of physical distancing. In addition to that, we are cleaning the touch surfaces, and we continue to update our reopening plans. All of them have been reviewed and will be going out tomorrow to inform families of what lunch actually looks like. And of course, we'll continue to update them, especially as fire season starts to kick up. Now, the next one, which was requested by the board, which is for us to come back with testing. So the first one is that the California Department of Public Health has rolled out a robust state and federally funded school testing program. So I'm just going to dive into exactly what we are doing. So the first one is that we will be doing weekly pool testing for all of our students. We will also test students if they have to enter a modified protocol. So that way we know that there's a lot of individuals who are struggling to get an actual appointment. And so we want to be able to provide that for them. So in the event that we see a positive case of the pool test, the next step is for us to give a rapid test. And then that rapid test serves as the first test in the event that there's been a possible exposure. The second thing is that we have weekly rapid antigen testing for staff. So all staff, certificated as well as uncertificated, if they are vaccinated, including someone like myself, will be tested weekly as the concerns from the board were raised about the ability to spread the Delta variant. For those individuals who are unvaccinated, so that reflects the 7% of staff, they will have daily rapid antigen testing, both certificated as well as classified, and that will start. It will be the start of that will commence on campus starting in September 6th. All of this testing is being performed with the help of Concentric, who will be sending a nurse to our schools. These all are nose swabs. That is a test that they are using. I know that there were questions about could we get other types of tests. At the end of the day, the fact that we were able to get this done and that our teachers as well as CSEA and MVA both agree and appreciate our stance on this is really good. So we look forward to implementing this as quickly as possible. So just to explain how pool testing works. For the most part, a class can have up to 25 students. Those 25 students is actually 10 will enter into a tube. Those 10 students are then tested at the exact same time. A reminder, this is all based off of consent. So parents and teachers, so parents have to consent for their child to be tested. If it's negative, then everyone is in that pool is considered negative. In the event that one of the people in the pool tests positive, then we will go back out and we will actually retest all the people who are actually in the pool. So quarantining guidance. So this was last week, or this was earlier this week, and it has since increased. And we continue to average. We're now starting to average more than one a day. It is possible that once we start testing, that we will see this number go up even higher. And so that is definitely something. There is no rhyme or reason in terms of how or where this is taking place. So, you know, it's happening across multiple schools. One thing I will say is that it has yet to indicate that there is community spread within the schools, which means that our mitigation strategies are actually working. And so that is the good part about it. But again, as we start to test more, we expect to see these numbers to spike. So there's been a lot of questions. It was a lot different last year, primarily because the data that we didn't know, or what we didn't know, really drove how we approach quarantining. And so now there is this whole decision tree about what happens if you're a close contact, or if you're symptomatic, or if we're just simply screening. So I'm going to go through this just quickly so that everybody sort of understands. If you're symptomatic, regardless, if you're symptomatic and you pass it, you take a test, then you are required to quarantine for 10 days. There's no questions about this. That's an automatic, regardless of whether you're vaccinated or you're unvaccinated. If you're vaccinated and you take the test, or actually if you take the test, you're symptomatic and you pass a COVID test, and you're allowed to return 24 hours after the fever resolution and improvement from other symptoms. Now, if you are close contact, so you are within the pool, or you are someone who we've identified who's a close contact, then it starts to go into sort of this decision tree, whether you have symptoms, whether you don't have symptoms, whether you were wearing a mask, whether you weren't wearing a mask. But the easiest way to think about this, I'm just going to go to the next one real quick, is that it then boils down to, if you were a student and you're fully vaccinated and you were exposed, if you're not symptomatic, then there's a modified quarantine that you have. If you are symptomatic, then there's a totally different process. And so our team spends a lot of time going through this particular process. The reason why this was developed is primarily because the Santa Clara Department of Public Health, as well as the California legislature, wants to make sure that students remain in school. It's also part of the reason why we have a masking program that requires kids to wear masks, both indoors as well as outdoors. And so the idea is that if you are potentially exposed and you were wearing a mask, then you have to take a test on day 1 and day 5, which allows you to go into a modified quarantine. If you refuse to take those tests, then you have to go into a full quarantine. And of course, we inform people which one that they are. And we work with Santa Clara Department of Public Health to determine whether or not we have an outbreak or not. Okay. So there was a question that actually came in from a parent. I just want to point out, if you are, and this one isn't captured in there, but I clarified this with Santa Clara Department of Public Health on Tuesday. If you tested positive, or if you had COVID in the past, You are able to provide us with a note because you would show up positive in our pools that says that you tested positive, and there's a window by which we would accept that before we would actually start to do retesting. So that's that 3-month window. But the quarantine protocol for vaccinated close contacts, and this is for students. So if you do not have, if you're fully vaccinated and you do not have the symptoms, there's no need for you to quarantine, provided you provide us with the following information: a vaccination card, you received your second dose, you remain asymptomatic, you're tested for COVID around 3 to 5 days. If a vaccinated student is experiencing COVID-19 symptoms, then obviously we need to, staff will notify the COVID detainees, and we ask that everyone stays home and get tested immediately. And then of course, those results must be submitted back to the school site. For unvaccinated individuals who are close contacts, now close contact is defined as more than 15 minutes over a 24-hour period within 0 to 6 feet indoors. They may continue to attend school in person if they are asymptomatic, continue to wear a mask, undergo testing twice a week over the 10-day protocol, and continue to quarantine for all extracurricular activities at schools, including sports and aftercare. This is the biggest difference between someone who is vaccinated and someone who is unvaccinated who is going through a modified quarantine. The biggest difference is that if you're vaccinated and going through a modified quarantine, you are allowed to attend extracurricular activities. However, if you are unvaccinated and you are going through a modified quarantine, you are requested not to, well, you won't be allowed to attend extracurricular activities at the school, which includes sports and aftercares. But we also recommend, and the county recommends, that activities within the community setting are also limited. There's no way that we can enforce the last part of that, but it is something that we want to encourage. But we're really primarily focused on what happens if someone who goes into a modified quarantine is placed in that predicament. We're looking at extracurricular activities and sports. So this is an easier way of looking at it. And I thank you to our communications team for pulling this together. It makes it real simple. And then again, what you can see, regardless if you're considered a close contact, number one, we want you to test immediately. But then the second thing is that if you're close contact, asymptomatic and vaccinated and had on a mask, then if you are allowed to come back to school in a modified quarantine, and you're allowed to participate in extracurricular events. However, if you are close contact and you are wearing a mask and you are unvaccinated, the difference is that you cannot participate in extracurricular activities or after school care, and of course, community events. So twice weekly, what does that mean? So first one, more than 15 minutes within a 24-hour period. You can continue, again, if you're asymptomatic, you've been wearing a mask, and you undergo testing. So testing, again, as I stated, will occur on the first day after the pool test is identified, as well as the 5th day. And starting on the 6th, we will do that ourselves in-house. Right now, as sort of a buffer, because we know that we have individuals who are trying their best to get trying their best to get tests, but unfortunately cannot get it. We are allowing people to show proof of appointment as part of the modified quarantine. Because of the situation with testing. And then after that, they have to provide us with the test results before day 5. No at-home tests are permitted. We cannot verify the veracity of someone taking an at-home test. They must take it with a doctor or a professional. Continuing education. So AB 130 is what guides us, not Senate Bill 98. So it is really a legislative reaction to the inconsistent distance learning approaches that occurred across the state. Unfortunately, though, Board Policy 168 was developed to provide parents with an option for short-term planned leaves. ISP was not designed to handle quarantine. And the reason why I say that is because ISP, or short-term program, really requires advance notification and approval. Currently, it says that it's a 5-day. It must be approved 5 days prior to it actually taking place. And then staff have a sort of a time frame once it's approved in order to develop a plan of action and provide work. The challenge here is that quarantining will come at any given time and doesn't necessarily necessitate the ability to do a planned leave. So we have some considerations. For the first one is there's been a lot of personal preferences about how we should handle COVID. I want to just reiterate that we are following Santa Clara County Department of Public Health guidelines. While yes, we go above and beyond some of them, at the end of the day, we cannot change what the modified quarantine looks like. That is not a call for us, nor, I know there are some parents or some people who are uncomfortable with the modified quarantine. That's not a call that we had. We're listening to the health officials that I meet with weekly, who are explaining why these particular things are taking place. We are averaging a COVID case per day. This will likely continue to increase, but all spread is occurring outside of campus. Mitigation strategies are developed through data. They are developed through benchmarking with other districts and consultation with the Santa Clara Department of Public Health. And there's a different guidance for K through 12 settings. And I just want to remind everybody that, our teachers, our principals are not health officials, including myself, are not health officials. But one of the challenges that we have is that we are noticing that our staff is being inundated with all these questions that people have about protocols that are designed by Santa Clara Department of Public Health. And while, I'm sure teachers and principals would love to answer those particular questions, they're not really in a position to be able to do that because we're asking them to educate kids at the same time to debate whether or not a particular policy or approach by the Santa Clara County Department of Public Health or the California Department of Public Health or CDC is designed. That's not really what we should be doing. We should be directing our attention to making sure that we continue to have a safe environment for everyone. And so, all I want to say is that we work closely with public health officials. I meet with them every week. Dr. Cody's team, I'm sure we all remember her, and I know she received a lot of praise. And then they are the ones who help us vet our approach to preventing the COVID-19 spread, as well as any other research and guidance from California Department of Public Health. And I do want to point out, this guidance changes all the time. It's constantly shifting. It is not as black and white as it was last year. There has been a question. So we did have a school that had 3 students test positive in 1 class. And so there was questions about outbreaks. Outbreaks are actually determined are determined by Santa Clara County Department of Public Health. They are not determined by school sites. They are not determined by teachers, nor are they determined by me. We must get the official outbreak consent from Santa Clara County Department of Public Health. And the other piece of this is that even if there was an outbreak, we don't have the ability because of Assembly Bill 130 to flip to online learning. That is something that requires the California Department of Education's approval for us to do this. So there are some concerns that we have, right? So it is possible, again, that as we start to test more students, we are going to see an increase in student absences. The remote ISP, independent school program that we have, a study program that we have requires a 15-day commitment. And obviously the quarantine is for that. And so parents who are going through a modified quarantine or who choose a quarantine instead of going through a modified quarantine do not fall into the ISP program that the state asked us to set up. Instead, they sort of in sort of no man's land right now in terms of what we do. Our teachers are doing, and teachers and principals are doing an amazing job to provide students with work. And I know that we have some other solutions that are coming, but at the end of the day, these absences or these quarantines are popping up at random, and so we're trying our best to get the work in there. The 10-day quarantine places students close to the research-based 10% absenteeism threshold. So it is possible that this is going to have an impact on 1 year's worth of growth, which is a board goal. And it is possible that this could have a disproportionate impact on certain demographics. So there's some guidance that we're looking for. The first one is, should staff make changes to the attendance code to reflect quarantining? Also, how should staff handle a parent who chooses to do a full quarantine as opposed to the recommended modified at school quarantine? The next set of questions that we have is, should staff make changes to attendance codes? How should staff handle a parent who chooses to quarantine? I'm sorry, this is a repeat. Excused versus unexcused is a direction to provide work to students who quarantine. Under what conditions should we try to provide the work? It is possible that this work may not reflect in-class daily lessons in order to meet the demands. Live instruction is not possible due to state limitations on distance learning, but also because of our commitment not to do hybrid learning, which is part of the board direction that we asked. Vaccination guidance, so around vaccination and testing. Earlier this week, the FDA approved Comirnaty. I know there was a lot of jokes about it. I may have just mispronounced it for adults. And so staff is looking for what board direction is on mandating vaccinations for employees. The EEOC did update their guidance to reflect that employers can mandate a vaccine provided that the employers comply with ADA Title VII, as well as other EEO considerations. And this was specifically updated for COVID. If Comirnaty and other vaccines are given full approval for young adults, will the board look to mandate vaccinations for students? If we were to look at Ed Code 49451, districts do have a general authority to ensure that their campuses are safe and have a statutory authority to exclude any student who is contagious. So there is the possibility of requiring that. Just some next steps. We're going to meet with focus groups to gather some more feedback and identify opportunities for growth. We plan on rolling out student and staff testing in the coming weeks. And then, of course, we will continue to monitor and evaluate our procedures and make adjustments as we get more information.
Thank you, Dr. Rudolph. Are there questions from trustees? I'm sure there are. Trustee Chang.
Thank you, Dr. Rudolph, and to the staff for that presentation. All the preparations been happening the last few weeks. A question about the indoor eating. When students are in the situations where they are eating indoors, and I know that's the minority of situations, are they is there any like assigned seating and trying to keep kids 6 feet apart, or are they typically in the 3 feet zone?
So for indoors, if they're eating indoors, they're typically, it depends, right? So it's all nuance. There are some instances where you can provide 6 feet of social distancing in the MUR because of the space of the MUR. And then there are other instances where they're eating in classrooms and you have to provide 3 feet distancing. The magic number, though, is 15 minutes. And so kids have to eat within 15-minute time frame. And so what you will see at some sites is if they are doing indoor eatings, they may flip, have some of the kids inside, some of the kids outside to reduce the amount of numbers. But 15 minutes is that maximum number. Now, if a kid needs to continue eating, 15 minutes, put the mask back on, they go someplace else, they finish their meal, then they're allowed to play, right? So it's sort of nuanced within that regard. And the 15 minutes is not 15 minutes of lunch. 15 minutes is once I get my food, I sit down, the clock starts once I sit, that 15 minutes. And so we've been working on purchasing timers for sites. I know that they've been using the screens and other different devices, but it's just a matter of getting kids to remember it's 15 minutes.
Trustee Berman.
So it sounds like some schools have made some changes to their lunch protocols. How many of our school sites are still needing to have students inside the cafeteria or eating indoors? And what are some of the constraints with eating outside for those sites?
So the number of tables we have is definitely a constraint. I want to say, and I've read through all of their plans, and it's really a minority. I know it's a couple. It's mainly on our school sites that are on a more compacted campus or that have a larger number. Vargas is probably the school that you'll see the most indoor eating take place. So it's hard to say, right? But part of the constraint, so we're just, because everybody continues to focus on Vargas. And so I know Principal Taylor continues to answer this particular question. So there is not enough space on a 4.5 acre campus where, essentially 2 of the acres are taken up by an AstroTurf field to put enough, and you were sent a diagram about this earlier, to put enough tables on the blacktop and to protect the fire lane that is there, and to have play fields, right? And so in his case, he has some kids who eat outside, but he does not have enough tables. So he has to have kids who eat indoors to some degree. One of the changes that we have looked into, I had Dr. Westover look into it, and she consulted with Jason Cave, is to also look at adding garage doors to the MURs, which will allow us, I know I mentioned this earlier, which allows us to roll them up. And then you sort of have this outdoor indoor, you can bring more tables closer. And so that's also part of the solution. But each school is a little bit different, and it just depends. There's not one school that has enough tables to accommodate everyone. And unfortunately, Castro, Stevenson, and Vargas are also the spaces. I mean, if you include the whole campus of Castro Mistral, you have some greenery or shrubbery that can help protect you. But Stevenson and Vargas are also solar boxes. It's also part of the reason why we wanted to put the shade structures up there, is because it is just basically blacktop. Now, granted, Stevenson is on a 17-acre site. There is a big field behind it, but that field doesn't have many trees until you go to the fence, which is on the outlining part, which is way out of their vantage or viewpoint. And so that's sort of the different challenges that we have. But I think each school has done a great job of trying to get as many kids out as possible, and at the same time, sort of reduce the amount of time that they're indoors. I would suspect, once, and again, we'll pick on Vargas, once the solar structure, the fence comes down, so it should disappear within the next couple of weeks. And the tables that are, we have tables that are being shipped out tomorrow. We have some more tables that are coming next week. We had a parent who also donated tables. Once those come, that, schools like Vargas can readjust their plans. Not that we're going to have, I think they needed like 50 something tables out there, or 60 something tables. Not that they'll have that much, but they'll have more space available to provide students who can eat outdoors. But I would suspect even then, you're going to see a hybrid of, there may be some kids that eat on the ground. There may be some kids that sit at the tables. There may be some kids that eat in the MER, and Vargas is going to make it work to the best of their ability, just because those are the constraints that campus has. And we've sort of always known that because it's the smallest campus that we have.
Vice President Blakely.
Have we looked into staggering the lunch hours? So like maybe first grade eats at 11 and second grade eats at 11:30?
Yep, every school has their lunches staggered. One of the constraints that we have is that, we can't run lunch all day. And so we have breakfast that we do, and then we do lunch, right? And so we ask our team to come in, our cafeteria workers. We've increased the number of cafeteria workers. We are feeding more kids than what we've ever fed before. We're almost averaging every single day, right? So they're busy making breakfast and snack, and then they turn around and they make lunch. So it is spaced out as far as it can, but it's only so far that we can go to give the cafeteria staff enough time to start. They do breakfast and they come back, they switch over, do lunch, and then they ship it back out.
I I have another question, but I don't know, are you going around?
Go ahead. Go ahead.
For the guidance, when you're asking if staff should make changes to attendance codes to reflect quarantining and how to handle parents who choose to do full quarantines, what kinds of changes, did you have particular kinds of changes in mind?
So we can explore and create different codes to capture the kids who are quarantining. If, there's a debate whether or not, so you can do a modified quarantine, again, if you agree to be tested. But if I agree to be tested and my child is identified as a close contact, then I may choose to keep them out for the 10 days, or I may choose for them to go through a modified quarantine.
Mm-hmm.
If I choose the full quarantine, do we want to code that as a quarantining absence? And do we want that to be an excused absence, right? Because they have another choice to come in, but they're choosing not to come in. And so what we're looking for is just a little bit guidance. I think it's important for us to track the number of students who are going through quarantine and look at sort of what the impact is. But whether or not we excuse it, or whether or not we say, you have the ability to do a modified quarantine, but you chose to do a full quarantine. That's really one of those policy decisions that we're looking for. And then,
well, and I guess the next question is like, what is the impact of that? Because we're basic aid, so that it doesn't impact the average daily attendance formulas. Obviously it will impact student learning, but I'm just trying to understand what the policy implications are if we were to change the policy then.
Yep. It looks like Kathy wants to say something.
Well, I was just going to say, I think it just helps us understand all of our kids and who's out and who's where. Because you do have kids that are in modified quarantine, but if they were exposed, not at school, then they're mandated to quarantine. So there's lots of different layers. So it just might be helpful to have some different codes to help us when we're looking at the data, understand what was happening with different kids. And then it's not going to help our chronic absenteeism rate, but it will at least help us understand what was going on with our numbers.
So essentially something like adding additional codes that are not excused or unexcused. It's like quarantined on-site, quarantined off-site, on-site exposure versus quarantine off-site exposure, something like that.
Something just to help us really understand who's where and what's happening. And then we really understand our numbers better.
Mm-hmm.
Yeah. One of the pieces, one of the benefits of doing this is that it also prevents us from reporting someone through the SARB process. Mm-hmm. So the SARB is a student attendance board review. In the event that a student hits X amount of days, we're supposed to refer them over the SARB. And then after that, the district attorney gets involved. Well, if you catch COVID twice, you're definitely going through both of those processes, right? And you'll hit the 10 days. We have kids who are quarantining now. They will hit the 10 days just from the start of the school year, which will refer them to SART or SARB. And that is one of the benefits of being able to also code them a little bit differently. In terms of whether or not we can parse out the data in terms of student performance, having the code may help us do that. It's just a question of whether or not we can use it. I'm not promising that we can, but it's at least something that we can definitely look into. But I think as Chief Academic Officer Bauer said, the biggest issue is that it is going to impact, no matter what, we're going to see an impact on our attendance and our chronically absenteeism rates. That's going to be the first immediate impact that we'll see. Whether or not the state sanctions us or recalls us to do something else, that's yet to be seen.
Thanks. That helps me understand what the questions were. So,
Trustee Wheeler.
It's going to be like Jeopardy, turning this into a form of a question instead of a comment. But have you contacted our local assembly member to ask if they're investigating a legislative fix for this kind of attendance record keeping issue? Because, this is going to be coming up all over the state.
Well, it's actually a great idea. I haven't thought about reaching out to either one of them. Definitely, I'm gonna put that on the list as one of the things we can definitely do.
And the other thing I was going to ask or say is, have you considered asking principals to either pay for or invite parents to have their children bring mats or towels to school, supply them, or ask parents to supply them, so that students can sit on fields that maybe hot, and then would help them spread out. I've heard that at at schools this is happening. I don't know if this is informal or what, but that seems like a commonsensical solution.
We haven't, I can't say whether or not a principal's asked. I haven't heard that as a strategy that public schools are using. I have heard that private schools, that's something that they're doing. I think in the case, and I'll use Vargas again, the AstroTurf field is a little bit different than asking a kid to sit on the grass. It heats up a little bit differently. It's just a place where you're just going to experience a lot more heat. And that's just one of the downfalls, I guess, that we never thought about when we were asked to put in the AstroTurf field. Grass is a lot cooler. So I can't attest to whether or not school sites have made that personal ask. We don't want to make that as one of the requirements, because if we do, per California law, we would actually have to supply it with everyone. So it's not a requirement that we have. I think, with more tables coming in and with solar shade structures going down, and I think with some other particular strategies, it's possible that we can get more kids outside, especially at the sites that are impacted. There's, I think Bub has 55 something tables. Landos has, I think, 61. And even with that number of tables, they're unable to put every single kid with 6 feet social distancing on the campus. And so a lot of people are using a lot of different strategies. Luckily, our maintenance department put dots, 6 feet social distancing dots up. So we try to use those. We try to use the tables. It's sort of a hodgepodge of a lot of different things to get kids outside, but it's not always feasible and it's not always comfortable. And I also want to point out that not every parent is technically comfortable with it. While there are some who are, there are some who want their kids to sit at tables, who want their kids to sit in desks. And so I think that's why you see this hodgepodge or amalgamation of different types of strategies to pull it off. But obviously every single site is trying to get as many kids outside as possible.
I would like to ask a question, then we can loop back around. One question is, what are the close contact rules for outdoor unmasked exposure? So when I look at the CDPH guidance, it's very specific. It says wearing a mask, unvaccinated students who are close contacts, which means more than 15 minutes over a 24-hour period within 0 to 6 feet indoors, can undergo a modified quarantine. But what are the rules outside?
So I'm going to ask one of our 2 COVID people to join in on that one. But my guess is going to say that it's actually the same. At least what I heard earlier this week from actually last week from the California Department of Public Health, it doesn't make a difference if you sit 3 feet away from a student outside at a table during lunch, you are still defined as a close contact. So you have to be beyond 6 feet in order to not be considered a close contact, whether you're outdoors or indoors, which is why the 15 minutes is probably the most important thing. But Tara, she deals with this a lot, and she could probably speak more to it. She's more of an expert than I am on this one.
Well, but I will say, I think you answered that beautifully, and I would have said the same. So it really is about the amount of time within 6 feet that that makes a person a close contact or not.
So then something that I've been hearing about is at one of our elementary schools, because they're seating students outdoors 3 feet apart, and they don't want to have a cumulative, they're worried about close contacts outside. They are having the children rotate, so they sit with somebody different at snack than they do at lunch. But if all those kids are in the same classroom, they're already close contacts, right?
It's a little bit, so here's the little bit of difference. So if you're in a classroom in an enclosed space, it doesn't matter if you're sitting within 6 feet, you're going to be in close contact because you're in that room. But when you go outside, that's where it makes a little bit of a difference. So we don't want people sitting within 6 feet of each other, unmasked in particular while they're eating, because then we're a little bit more concerned about your proximity to each other outside if your mask is off while you're eating. So if you're outside in close contact within 6 feet, you're a close contact. If you're inside the same classroom, whether you're 6 feet or not for the whole day, you're a close contact.
So I guess what I'm trying to understand is it sounds like this strategy is very well intentioned. It's to not have students be in close contact with another child for more than 15 minutes with their mask off. But instead it's increasing the risk points to an exposure to 2 different children by having one 10-minute stretch for snack with one kid and one 10-minute stretch for lunch with another kid. And it may even be mixed. I don't know if it's mixed by classes or not. But if you're already going to be a close contact because you're in the classroom together, when you're outside, if you are only seated within 3 feet of one person from your classroom, could we exceed that 15 minutes and let them stay as that only point at snack and at lunch instead of increasing their exposure points?
I think the part of this idea too is that the requirement, if you're unmasked, is different than masked when you're a close contact. So there are so many pieces of the guidance. So it's not only about
that's what I'm trying to understand. What are the requirements if you're unmasked?
Right. So if you are unmasked for more than 15 minutes in close contact, then you don't really qualify for a modified quarantine. You would need to quarantine at home. This is what we're trying to avoid, is having to have children be at home under quarantine and not being able to continue coming to school. So whether you're a close contact or not, that 15 minutes of being unmasked then adds that additional layer on top of the close contact piece.
So we have 2 bad choices basically to choose from.
Right. So we're increasing the number of close contacts, right? Because they're sitting at an assigned seat, but you're not exceeding the 15 minutes within 24 hours of a cohorted group.
Right. I think what's hard is that 15 minutes is sort of it was a magical number with the first round of COVID. Whether or not it actually applies for Delta is up in the air. And so I worry that a smaller amount of exposure to another child with masks off, undistance, that, instead we're creating 2 dangerous exposures instead of 1. But it is a very complicated problem.
I think this is what happens when we're trying our best to get as many kids out as possible, and we have multiple breaks that require for them to go out. And this is at one of our largest schools, right? And so the ability to spread kids out and to keep class going becomes somewhat limited. And so it's definitely something that we can take under advisement and sort of revisit and look at. It's also possible to add in a couple more tables may do some help to some degree. And obviously when the shade structures come online and we move some tables out, it'll give a couple of those schools greater flexibility to spread kids out also.
Could we also look at bringing volunteers on campus who are vaccinated and undergoing testing with our teachers to help with yard duty so we could spread kids out more?
Well, that would require the board to change its direction to not have any volunteers on campus. I'm sure parents and staff would welcome the opportunity to have people on campus. Whether or not we can include them within our testing regimen, I would need Tara to show back up to answer that one. I think the answer is no. But what I would say, and obviously we want parents to be dependable, but I know for a fact that would definitely help some of our sites, and that there are parents who have advocated if it's outside. Obviously we don't want them inside the classroom, but if it's outside and they're masked and they're vaccinated, I know it would be a big help. We've seen parents who have helped for arrival and dismissal, and that has sort of helped too. So it is possible, but the board will have to change its direction on volunteers.
Other questions from trustees? Trustee Chang, we'll go back around.
Thank you. A follow-up question from Trustee Blakely about the codes for excused and unexcused absences. If a family is a voluntary quarantine at home, whether excused or unexcused, does it change our duty of providing makeup work if they were unexcused versus excused?
I don't think it changes our duty. I think it's just more for us to track the information. I think, again, we're doing our best to try to provide kids with as much work as possible. Doesn't replace, having them the live instruction, but, that we want to make sure regardless of whether you're absent or not, that you're providing them work. Obviously, if a parent chooses, what I would recommend and what I would do, if a parent chooses to quarantine, I want to quarantine Eli, I'm going to let the teacher know and let the principal know I'm quarantining and please send some work. And that, Eli's going to come back in 10 days. So that would be the one thing we would need. Obviously, we won't be able to determine, if somebody keeps a kid out and then sort of in a ad hoc way said, hey, my kid was out because of this. Where's all his work? I think that becomes a different conversation. But yes, our goal is to provide some. And then, of course, we can also use iReady and provide, there's the assessments that we can issue in iReady. And then there's also assignments we can issue in iReady. There's also the assignments that naturally occur based off of the testing, which we've just completed, that kids can do also to build their skills.
And just a quick last question is the minority of staff that are unvaccinated that are doing the daily COVID testing, is that something that's also funded through the state, or is that on the paid by the district? And if paid by the district, is that a large expense, the daily testing for non-vaccinated?
It's a part of our agreement with Concentric, which is funded through the federal government, as well as the state. So, and we have TAs for both of them right now with our unions. So they're really appreciative of that, of the safety precaution that's been put in place at your direction.
One quick follow-up for that, sorry, is and without going into individual details, are we seeing any increase in our district healthcare cost related to unvaccinated workers needing medical care?
I don't know if we've seen any increases. Dr. Westover, thanks for jumping in.
We are a part of a larger JPA when it comes to health insurance. Currently, we're not seeing any major increases, but we are part of that larger pool. And we're just monitoring to see what the next year will hold, but we don't know next year's rates yet. And
any guidance if there will be pressure from whether in the JPA, as in like that cost could rise if districts do not have higher percentages of vaccinated staff?
That's not something that we've met and spoken about yet. I think everyone's focus right now is just reopening school and getting kids into classrooms, but I'm sure it will be a discussion point coming up this year.
We also may see some increases just because the CARES Act, the protections for COVID leave are about to come to an end. And so that may drive some of the costs up. So for instance, right now, all COVID testing is covered under our healthcare, but I believe it's at the end of September that changes. Luckily for us in the school setting, right? So while I would have to pay out of pocket for a COVID test, or whatever the fee is, because the school district has a contract and is paid for, compensated by the federal government, and school employees and students wouldn't have to worry about the added costs.
Thank you.
I think Trustee Berman was next, and then Vice President Blakely.
Thank you. So can I just clarify one quick thing over on the slides? So the slide that said twice weekly testing, what does this mean? It was right after the new infographic about close contacts. So it says unvaccinated students who are close contacts may continue to attend school for in-person instruction if they are asymptomatic. I'm assuming that means that if they had been masked during the contact, correct?
Correct, because we're not allowing students to not be unmasked.
Got it. I assume so. I just wanted to make sure that was clear.
Yep, and the twice in a week is really is 1 in 5 days, which technically is a week, but I know we often think of work weeks, so it's possible that could be day 1 is Wednesday, day 5 is Monday, or something like that.
Got it. And I'm sure that school staff has received dozens of calls a day just with clarifying questions about protocols and what to do with their child when they have a cold, a cough. Should families continue to do that? Should they continue to just reach out to their school sites, or how can we make this more manageable for our staff?
Yeah, so the first one is okay to reopen. What I would say is if you truthfully answer that, it's going to tell you if you have symptoms, whether or not you should come in. You're more than welcome. I don't think asking a question about whether or not my child has a symptom is really where the burden lies. I think the burden lies on the other end, which is the questions around ventilation, the questions around mitigation strategies, the questions around, distancing and everything else. At the school site, they're trying to execute what we've asked them to do. And so I think those questions are, asking a teacher what's the average air exchange in their classroom, they're not going to be able to tell you, right? What a teacher will be able to tell you is I got a MERV 13 filter, and now I have a portable HEPA filter in my classroom. I get tested either weekly or every day. I mean, they won't tell you that part because I've disclosed whether or not they're vaccinated. So I think those types of questions have to go towards the district. We have an email, we can answer them that way. And then I think sometimes we just have to accept, like, this isn't, whether I agree or disagree with the modified quarantine is besides the point. That's what Santa Clara County Department of Public Health and CDC and the California Department of Public Health have put in place, because the goal was to get kids in to school because of the impact that it's had, right? And so we have to accept that and then focus our attention on, so how do we make this the best that we can? And I think for questions around mitigation strategies, I would encourage people to just email either our questions, or they can email supt@mvwsd.org, and we can answer them that way. That would be a better use of time, because I know the principal, that we're asking principals to make sure that learning is taking place, and to evaluate teachers, and to make sure kids got supplies, and that, their mental health is there, and they're doing all these other things. So it's just, I think it would be a benefit to take that off of their plate and allow them to do that work, and then let, my team focus on answering those particular questions as quickly as we can.
Thank you.
Vice President Blakely.
I just wanted to confirm whether the testing was available for our parent volunteers. I think you said it probably wasn't, and I thought I saw Ms. Victor nodding or confirming that, but just trying to confirm what the status is, and also if the answer is no, is there any way to modify the consent contract to allow for that. I'd heard anecdotally that the high school district was testing families of kids who were close contacts. I'm not sure if that's true or not. It may just be a different contract, but.
At this point, our work with Concentric is really for our students and staff. And, we've ordered our supplies for our current students and staff. And so I'm not sure that we could include family members in that. I could certainly ask, but at the moment, it's not a possibility to change what's coming for the upcoming month.
That includes volunteers.
Correct.
Okay.
I do think, though, that if a volunteer is outdoors and is wearing a mask and provides it with their vaccination, I think it brings the level of anxiety down a little bit, as opposed to if it was a vaccinated volunteer who was in the classroom, there would be a larger concern that way. Obviously, by us doing testing for adults, our staff members and students, it also reduces the burden on the outside healthcare system, which may create more availability for parents to get tested. Or if a parent is really that concerned, they can also do their own at home. It's just not something that we would accept. The other thing I forgot to say is just with our testing regimen, right before each break, we will send home a rapid test to provide peace of mind to individuals, for students to take the testing.
And on the possible changing of our guidelines around volunteers, is that for outdoor volunteering only, or would that also be for in the classroom?
No, I would, if there are changes to the volunteering status, board's direction on it, I would only ask for it to be for outdoors, to help when we see the most traffic, arrival, dismissal, as well as, we could argue that snack time, and then we could also argue dismissal. We have to be clear or careful that we're trying to hire as many noon supervisors as possible, but that we have to be careful that we're not using that as a reason why not to hire noon supervision duty supervisors, because that brings an issue up with CSEA and their collective bargaining agreement. But I would only ask for lunchtime. Snack is kind of short, but sometimes it bleeds into lunchtime, before and after. And I think that would be a big help to the sites, as well as to the principals who are trying their best to provide coverage. I know when I was out at Landals, there were all these kids running around, and and they're happy to see each other, which is great, but it's a lot for the number of adults that we had out there.
Trustee Wheeler.
Yeah, can parents pick up their child for lunch?
There are some schools that allow their parents to take their kids out for lunch if they're uncomfortable with their kids having indoor masks or eating indoors. So that is a possibility. We are reserving that for school sites that are mainly focused indoors. We don't want to have a bum rush of kids who are parents who are like, I just want my kid to eat lunch with me and then bring them back and create another issue. But it is definitely something that I know sites have been taking into account and allowing to take place. And for the most part, it's been pretty easy. Obviously, it's not a strategy we want to completely recommend, because some sites have 600 kids in the lab. Not that all 600 are going to show up and say, I want to take my kid for an hour, but it is possible that it can be a little bit overwhelming.
Thank you.
So it really feels like one of the most challenging parts of the day we have is that moment when children have to eat and they take off their masks. And as a parent, I feel that the idea of my child being close to someone else with the mask off, especially indoors, definitely freaks me out a little bit. And so we're trying to figure it out at every school site. I know that the principals meet regularly. Have we had a lunchtime workshop summit to compare what people are doing across different sites and really share and strategize together?
They've been sharing in the reopening plans. You'll see different groups of principals who cluster together. I think, again, I would say each school is a little bit different. And even within the schools, right? So we have two-story schools, Vargas and Castro. But Vargas and Castro are in two different footprints, and their schools look completely different. And so they do their best to share ideas and to share ways that they're, sort of exploring it. I know that we have a PLC, a professional learning community, that principals go to before they come into LT meetings. I know you can tell in their plans, you can sort of get a feel for which principals are sharing what with who, because you'll see things that look very similar. So they are sharing a lot of the ideas. There's just some natural constraints that just exist right now at different sites. And, what I would say to their credit, through each, we're technically day 10. But what you see is a lot of reiterations of lunch and sort of a reimagination of how to pull it off. And so each week they're trying to do something different based off of what they're hearing from their peers in order to try to get more kids out.
Yeah, I was really impressed at Mistral because they went from some kids inside and some kids outside to everyone outside, but having half the class eat while the other half plays and then switching them. It's still a fine dance when you have multiple grade levels doing it, but I thought that was really innovative. My last question is, when do the HEPA filters arrive?
First shipment comes in on the 30th.
Woohoo! That's great news. That's great news. All right, are there any further questions from trustees before we move on to public comment? Okay. If you are a member of the public and you would like to comment on this item, you can raise your hand in Zoom by pressing the raise hand function, or you can press *9 on your phone. All right, at this time, we have 3 speakers. Each speaker will have 3 minutes to speak. We will not take additional speakers after these 3. We're going to get a timer up. And Alvaro, I think your hand was up first. You may unmute yourself and we will start your 3-minute timer. He has not started speaking yet.
There you go. Can you hear me?
Yes, very good.
Yes. So thanks for the opportunity to participate in this. I think we all have lots of questions and lots of comments. And as usual, thank you for all the hard work. I know this is we're faced with 100 different contradictions every day that we have to navigate as parents and as a school board. So we're gonna appreciate everyone's flexibility here to allow space for each other. Just one quick comment about the slides. Please, whenever you quote recent evidence that shows something, it'd be great if you can actually link the evidence, because it's interesting for some of us who are very curious about this stuff, and we really want to understand how the decisions are made. And again, and don't interpret it as a criticism. It's really out of curiosity. We want to understand the process a little better. One comment about the barriers, the fact that the barriers are flimsy. They could be paper and still inhibit airflow, because either the air does go through the barrier or it doesn't. And so unless it's porous and it has holes, my point is that airflow is a complicated thing, and I guess it can be measured. So I might suggest that perhaps a random study of a couple classrooms or 3 classrooms might actually be possible to understand what the effect of these things are. Because it really depends, for example, on where the outlets of the air are. You might find that a corner of the class is extremely well ventilated, but the other corner of the class where there's a couple of kids is not. So this stuff is really complicated. That's all I want to say. Also, let's not celebrate. Also, just about one of the comments that I heard, let's not celebrate about school transmission not happening yet until we have robust testing. We really don't know if if the kids are passing it around. I'm really hoping that it's not the case, but we need the testing to be in place for us to make that statement. Another thing about the testing cadence, Delta is able to transmit at least twice as fast as the initial variant of the virus. The onset I think that the average of the onset of symptoms for the initial variant was about 6 days, whereas now it's about 3 days. And it's thought to be transmissible up to a day and a half before, which means that with Delta, you might be able to pass the virus in a day and a half. So 1 week for testing is just not enough, in my opinion. And I think one creative solution around this might be, for example, if there's a case in a classroom, you might choose to do daily pool testing for a few days until all the kids are clear, because that would allow us to react quickly in case of a positive case. And finally, in my last few seconds, our principal explicitly told us that it was not a possibility to pick up our kid to lunch, which we were thinking about the smoke. Anyway, so guidance about wiggle room would be appreciated. Thank you.
Thank you. Our next speaker is John Togasaki. John, you may unmute yourself and you have 3 minutes.
Thank you. So the first thing I want to do is just kind of reinforce President Conley's comment about the exposure during lunchtime. The 15 minutes doesn't mean it's safe. It just means it's allowed. And so if you have, let's say you have a child who's infected, COVID, the Delta variant has been shown to be transmissible much quicker than 15 minutes. And so if you have someone who's infected, the more people they're close to, the more people can get infected. Where if you keep them, just with one person, even if it goes over the 15 minutes, the likelihood of spreading is, you're going to control the spreading at least a little bit more. Let's see. Actually, one other question I had was, so with the modified quarantine, I was just wondering if the rules are that when they're allowed to continue at school, if it's business as usual, where they can do everything they could have done if they weren't under modified quarantine, or within school, not extracurricular activities, or if they're trying to mitigate the spread of the virus by limiting things like STEAM, where they're going to other classrooms, exposing themselves to other teachers, where if that teacher gets it, they're exposing themselves to lots of other classrooms and it could spread much quicker, or all those classrooms would go under modified quarantine if that teacher were infected. Sorry, I have a lot of points, but trying to get through them. With the dashboard, the district dashboard, I was wondering if we could add the modified quarantine numbers, because right now there's no indication of that. And also, I don't think it's a really effective method of communicating the numbers because there's no history. So unless you're looking at it every day, you can't tell if it's changed or if it's been updated. Let's see. And sorry, I'm trying to go through everything. Also, let's see. I can't think of anything, so I'll just leave it at that. So yeah, thank you for your time.
Thank you very much. Before we move on to our next speaker, I saw a fourth hand pop up, and I want to kind of explain for everybody how the time is allocated. So the school board allocates 10 minutes for public comment for each item. Thus, if we have 3 speakers, each speaker can have 3 minutes. If we had 5 speakers, each speaker would have 2 minutes. So I gave the first 3 speakers who raised their hand, I allocated each of them 3 minutes. We technically still have 1 more minute beyond that within the public comment time. So Ben Lickley, after Jenny has spoken, you can have 1 minute to address the board. I know that's not the same as the other speakers, but it's because I allocated their time based on the number of people who raised their hand when we did open up for public comment. So Jenny, you will have 3 minutes.
Thank you. I'll see if I can do it in less than 3. Thank you so much for this really thorough and thoughtful update and all of the questions. I really appreciated it. And good to see all of the thought and hard work that's gone into this. I just wanted to echo something that Dr. Rudolph said regarding having on-campus volunteers outdoors. I would really appreciate if the board sees fit to give guidance on that. There are a lot of cases on our campus where if we could have on-campus volunteers, it would be a huge help. And I'll give you just two small examples. One is that at drop-off and pickup, we would love to be able to have volunteers quickly come on campus, help put up shade structures, and then leave. Right now, the only option would be to come in at like 7:30 and 4 o'clock, and it's really hard to get volunteers to come outside of school hours like that. Another example is, this is at Stevenson, kids enter from Montecito, and for the most part, they're all fine, but every now and then there's a new kid that gets a little disoriented and is just kind of stuck on the field crying, and parents are standing there on the street and can't walk in to help them around the corner. Luckily, in that particular case, there were some older helpers that came out and helped guide that kid to class, but we would just really appreciate if you see fit to allow vaccinated, masked adults on campus at the principal's discretion for these little site-specific challenges. That's it. Thank you so much.
Thank you, Jenny. So Ben, I think between the two speakers that didn't use their whole time, you actually will have 3 minutes. You may unmute yourself, Ben, when you're ready.
Okay, thank you. I really appreciated all the detail you went into, and it seems like there are a lot of really difficult trade-offs that you have to make between like increasing safety and decreasing transmissibility on one hand, and like having high quality in-person instruction on the other hand. And it just strikes me that one mitigation strategy that seems like it doesn't suffer from that is the stricter mandates about vaccinations, because those are both making everyone safer and less transmissible, but also potentially, if they can prevent people from having to quarantine, like also making the instruction better. So from my perspective, those strategies in particular seem like win-win strategies that I would strongly support, and would make me personally also more comfortable sending my kids back. So that was the main thing that I wanted to talk about. So thank you.
Thank you, Ben. All right, comments from trustees. We have a lot of guidance to respond to as well. Oh my, they all went up at once. Trustee Wheeler.
Yeah, so I think maybe everybody's going to say the same thing, but I would like the board direction to change to allow in-person volunteers who are masked and vaccinated to help outside.
You've got a unanimous straw poll on that one. Further comments? Okay. Trustee Chang.
Oh, can I say I am waiting for, I thought there was going to be a segment in this item where Dr. Rudolph is asking for board direction for questions that were inside the presentation.
Yes, so we have, if you want to respond to that now, you can.
I don't. I would like to have everybody do it together.
Okay, so general comments first, and then specific response to guidance? Or do you want, I'm not sure.
That would be my preference. And what I would prefer is when we're asked for that guidance to put the guidance questions up on the screen.
Okay, so let's do general comments first, and then we'll circle back around and we'll go through the guidance points one by one.
My comments were all going to be around the guidance, so I have no general.
Trustee Chang.
Thank you. Things about not the ones on the slides. I guess my main comment would have to do about that eating and unmasking, and that I would strongly encourage our board to just make a statement that people can't eat indoors with masks and put that as a design restraint. And I am very confident the sites can find a solution. I think that the solutions that being already happening in sites, staggered schedules that are already happening, spreading students out, perhaps with the aid of volunteers and expanding. Because when we're talking eating, it's only 15 minutes between students uncomfortable sitting on a towel on a hard deck for 15 minutes. I think we can. I think if we as a board prioritize the safety, them and their students in their mask is their primary form. But they are unvaccinated students. That is their primary safety measure. And I agree fully with President Connolly that it is our one largest source of risk. So I would encourage our board to say, you know what, as a board, we do not want kids eating anywhere. And I understand indoor-outdoor spaces, it gets fuzzy, right? Like, is an MUR with a garage door a indoor space? And I actually don't think it is. I think that at some point, a building is porous enough where the air outside and inside is freely exchanging. And I think that could be a part of the innovations. But it just doesn't make sense because, you know, so especially for classroom eating. So if kids are eating within 6 feet of each other, like indoors and in some of the indoor settings, I just think that I think that we could just set guidance there. In addition to that, something I think I really am appreciative of the district doing, and last time we had a meeting, you know, I spoke about really concerned about that, you know, that masking it. We should do more in educating people about the importance of quality mask. I underappreciated that meeting and have since really understood that our district in deciding to test every student weekly and the pool testing is unique. And I really do believe that it is also, while I think mask is our primary safeguard, I think we're really doing the families a wonderful service in keeping their kids safe by doing weekly testing. There was I think everyone here on the board saw the spreadsheet of what the other districts are doing. And then I think a lot of parents are not realizing that very few districts are testing their students as all students. Palo Alto and other districts are doing voluntary testing. And I think that I am so relieved that we're not doing voluntary, because it's the non-voluntary ones I think we want to worry about. I think that I wish I wish a lot of parents realize that that's something we are ahead of the game. And I hope other districts do it too. And I really thank the district for doing that. I think Dr. Rudolph said in some of the comments, but I don't know if all the parents got that part of the contract that the district has is this concentric will also be able to provide the testing for the modified quarantine. So right now, because testing's not up yet, I know that a lot of parents have had trouble figuring out, like, what do they do about the test if they get a notice that they have to test? You know, they can go to school, but they got to do a test to go to school. Where do I get it? And it's been a little confusing for families. But this concentric contract solves that because we'll be providing on-site testing for that. I just think that's amazing. And I really hope parents hear that. One last thing about the dividers in the classroom. I really wish we didn't have the dividers. Other school districts aren't using dividers. I don't use dividers at my work, you know, and we don't eat inside either at my work. At my work, you know, kids do what Trustee Wheeler said. We have people have towels and blankets and markers, and they go outside and sit on the concrete. But then I want to bring the divider. I don't really think the divider is that big of a danger, but I want to bring it up as an I wonder how we made that decision, because I worry that, like, we say we're making our decision based on the science, but the science isn't saying that dividers are really important. So like it brings up this question of like, we've had parents who are working in the medical field say that dividers aren't helpful. And there's experts in the community, you know, so like whether it be like, you know, top, you know, people who are the top in the nation, people, you know, Richard Corsi and Lindsay Marr, that, you know, 2 professors, experts in this field of air and infections, say that dividers aren't good, you know, and the New York Times report on that recently. So like, while I'm not alarmed about the dividers, I do think it begs the question, no, other districts aren't doing it. We are. Why are we doing it? How are we being advised? And tied to that is I really hope that we hear, I really appreciate this update. And I really wish we had to update in a discussion last meeting, because there's so much we learned from each other that we want to process and then hear from each other again. And there's so much we learned from the parents and community members who email us that this felt long. Like, I think that especially the community update. So like, we all listen to community update, we read the emails, and we hear each other right now. I would have welcomed that processing. So like, I hope after this item, I'm sure that we're going to learn from each other even more now, that hopefully this item comes back again so that we can continue to process, because some of these decisions that they're asking guidance for are really big. And the first time we heard it, I think we were asked to make decisions, and kind of like, I felt like those were the opening gestures, but those opening gestures got taken as final decisions, like things on volunteers and things like that, that I felt like the board's word, the first time they hear something, shouldn't be on life-death situations. I think things like this, we should be churning. And I was afraid some of the things we said the first meeting became guidance that, so I'm glad we had this meeting. Thank you.
I will say, I think the numbers on the ground and the conditions on the ground keep changing so rapidly. I mean, frankly, I called this special meeting because I felt a lot of urgency around, and I knew our staff was working on all these things. So when was the opportunity for them to share it out? And when was there an opportunity for us to discuss it? But that means that those presentations were put up on the website this morning, because what staff had expected to be a 4-week turnaround, instead, I asked them to do it in less than 2 weeks at the same time as opening schools. So I don't think we could have physically done it faster and still had a leadership team to show up and keep their jobs here with us. But Dr. Rudolph and I have talked about having just kind of updates in future board meetings. So we keep, because things are going to keep changing. So we're going to keep getting updates. And for the public, I have 2 recurring nightmares that I live with right now. I'm not sleeping so much, but that's okay. It's not forever. One is school-based transmission. As a parent and as a board member, that's something that I'm really concerned about and want to do our best to not happen. And then my second one is that we burn out our team and we lose principals, or we lose people from our leadership team, because, you know, just as traumatized as I am as a parent by like going to stand in line and see hundreds of other people when I've been away from people for so long, our staff are now on campus with hundreds and hundreds of people, and they're being asked to literally pivot like some sort of startup when that is not how schools function. And so we can make all the great requirements and suggestions we want as a board, but if we lose our people, our good people who are doing the work, then we really are up a creek without a paddle. So those are the 2 things that I have nightmares about. And then I wake up every morning, and just like everyone else here, we have been tolerating a lot of ambiguity in our lives and in the world. And I wake up in the morning, and each day I have to make the choice about whether or not to send my child to school that day. Does the risk of sending him outweigh the risk of keeping him home? Because both of those things can be problematic in different ways. And our goal here tonight, the reason I called this special meeting, is because I want to make sure we are giving parents as much information as possible about what is happening at the school site, and the reasoning that we're doing, the changes that we're making, how we're trying to take care of their kids. But also they need that information, because each parent, you have to wake up each morning and you have to make that choice for your child. And I wish it was easier. I wish you could make the choice now and it would be the same for the rest of the school year. But for many of us, it's going to be every day waking up and figuring out what that day is going to hold for our family. So I just want to put that out there so that everyone knows that we are really concerned and we're with you. And we understand it's hard, that we're doing our best and we're asking a lot of our staff. Are there further comments of trustees before we move to the guidance? Trustee Berman.
I'll try to be brief, but I can't not just thank Dr. Rudolph and his team and for putting this presentation together and sharing all of the mitigation measures that are in place. Thank you so much. I'm really relieved that we had this meeting. I think that there were just a lot of questions out there. And I feel like this was a great opportunity to communicate what's happening at our school sites and what our plan is. And as a parent, so similar to what President Conley just mentioned, I have 2 children under 12, they're in Vaccinated, and I make a calculated decision every single day when we leave the house, and I calculate the trade-offs. And I feel really confident sending my children to school, and they're both happy and thriving. And every day I feel relieved that we're in person. And I also want to thank the principals who have just updated and revised their plans and just have gone above and beyond to make their parents and their students feel reassured and feel heard, and for making adjustments. And I know that some of these adjustments that they've made seem small, but there's a lot of work behind the scenes that happens when you see those small adjustments from the outside. So I appreciate the effort. And I also just think what a difference that can make for our students. And even if it makes a difference for one student, it's worth that effort. And sort of with that in mind, I think about, what other small things could we do to make families feel safer? And, one of the things that does keep me up is kids eating indoors without masks. As in my family, we don't go indoors to eat without our masks. So I think about families sending their children into our cafeterias, and there's so many variables with the rotations and the distance and who's exposed and who isn't. And there's so many unknowns with the Delta variant. But that's one piece that I would really like to resolve, so that there isn't this ambiguity and potential risk, because I see how solid our plans are, and that seems to feel like one small thing I'd really like to see us address. And I'll make my comments about the other direction that Dr. Rudolph needs when he asks.
And I will respond to that, Trustee Berman, as well. So I think a good an example of kind of the situation we're in, I think, around indoor and outdoor eating. I went to like a recycling workshop recently, and the people were presenting on the different plastics you could recycle, and they were like, look, it's not recycling, it's wish cycling. Most of the things that are marked as recyclable aren't actually recycled anymore, and you're wishing it into the world, and it doesn't actually happen. It goes and ends up in your landfill. I want to give useful guidance, but I don't want it to be wish guidance. I want it to give, if Principal Taylor needs 10 more people to watch his kids at lunch, then yes. Or if he needs 100 million tables, yes. If we need to pull up that turf and put down grass and just say goodbye to a turf field, let's do it. I want to figure out the best way we can support our principals, because they're taking the heat on this decision by themselves. I know they're working together, but they're the ones who are the interface with parents about it too. And I know it's a hard spot to be in. And I want to give them, if they come up with a creative idea or something they want to try, I want to give them the support of the board in doing that. That's a little bit different than mandating it. And I'm not sure if mandating it would actually achieve what we want or not. So, but I think that there is a majority of the board between Trustee Berman, Trustee Chang, and I who would really like to see as many kids as possible eating outside, and any way that we could support that. Does that sound fair to say? Okay. All right, and guidance, and we'll start with Trustee Wheeler on guidance. So let's pull up Dr. Rudolph, if you want to share screen again for those final slides. Attendance codes, Trustee Wheeler, and whether it's an excused or unexcused absence. You're muted.
Okay, so my answer to the first question is yes. I think we should honor regarding question A, I think we should honor the parents' opinion about this. Excused versus unexcused, this is where I hope that the state legislature works on this, because I think we should allow parents to keep their kids home if they feel like they need to for health reasons, and the student and the school should, and the district should not be punished for this. This is such a dilemma for me about what kind of instruction to give to students who are in that in-between space between independent study and the program that we contracted with. I know that this is more work for teachers, but I think that we should ask teachers to provide, assignments or paperwork or something for students who are going to stay home. So, and that isn't a lot different than, in the old days, if somebody was sick for 7 days, teachers provided homework. So, I think that, the alternative is we say, we can't provide that work. I've read stories, I'm sure others have too, of students staying home and then they run out of their work in 3 days. So, if we want our students to catch up or stay up this year, then, we have to be willing to be more creative and do more work.
Would anybody else like to go? I can't see everyone's hands. Trustee Chang.
First thing about Zoom, I don't know if everyone's done this already, but if you want to see the colleagues while we see the slides, under the view, you can view gallery, and then you can stretch your panel so that you can see more than one person at a time and still remain to see the slides. It's in the upper right corner of the view button. I agree with just earlier on and I think this sounds like an excuse, and I think I think that giving family flexibility. I think our philosophy should be families have it hard. How can we make their lives easier than harder? So I think Trustee Wheeler is right about those. We're on the last one about the makeup work. This could be really tricky. Right now we are pre-testing. So like right now, like teachers, there's only 14 positive cases across the district. That's pretty light. But like this could very quickly become something that that encroaches on what we were trying to avoid, which is burning out teachers when they were simulcasting and also degrading the in-class experience. Because I will say right now that I am teaching with students in quarantine, and it dramatically changes your attention and focus when you are focusing on the kids in the room versus focusing on also having a plan for kids at home or in whatever form, whether it be asynchronous or live. It just adds another thing to your bandwidth. I saw in the board questions that we submitted that our district's down 500 students. So we pre-COVID 5,000, right now 4,500. I wonder does that give us some space and staffing and some extra staffing to just allocate a handful of people to maybe do the ones who provide these kind of like middle measure for quarantine lessons, right? Like we're a pretty standardized district. It was in following standards. I actually think there's gonna be some point where it would be an aid to our teachers where if a student has to quarantine at home for 10 days, that they didn't have to make the lessons for that, because they do that for 10 days and another student for 10 days. And it's basically their lesson planning a secondary track all year. And at some point it may be beneficial, maybe not. Maybe we have to see what our testing routine looks like. And if we are, but I welcome this coming back to us if we see a lot of kids quarantining. And then we go, do we create a kind of what we were planning on to doing last year, that online squad, right? It's a handful of teachers who are in charge of putting the packets together and distributing these packets to those families who are not gone all semester, but just out for a short term. So something in between our contract with Edgenuity and something not having classroom teachers having to divide their attention.
Do you know what that makes me think of, Trustee Chang? Dr. Rudolph, all of the online lessons that teachers did through Google Classroom last year, do those still live somewhere or are they gone forever?
So for middle school, yes, they still live and we could utilize those. For the elementaries, we never used a virtual team because we used them to cover teachers who went out on leave and some other stuff. So we are working on a secondary solution, but it won't, that's why I think earlier or in this, I put as possible that the work won't be the daily lesson that the teacher's providing. It would be more the lesson that it may be based off of the trimester. It could be work that, because we have a pacing guide. We sort of know which standards are covered, but it could be, something that's related, but not necessarily that actual teacher's work. And again, it's not that teachers don't want to provide work. It's just, like for instance, we sent out a bunch of close contact notifications today. To ask the teacher to turn around tomorrow and have work, it's not going to be reasonable.
I know the elementary school teachers had a Google Classroom site. Is their old Google Classroom site where they did lessons every single day for the entire year last year? Is that gone, or can they still? In an ideal world, we would have somebody who could like mine those different Google Classrooms and pull things.
That I know Director Akers on here. I would lean towards him to answer that one.
Well, he can get back to it later. It's just something, I know that there was so much work that was put into the online learning.
I'll put it down as a note or something that we can look into.
Okay. I agree with people so far on we should change the attendance codes to reflect whatever we need it to show for staff to track, whether it's quarantine, modified quarantine, both. I also agree that I think we should allow these as excused absences, but we're going to have to advocate up at the state so that there aren't penalties around that for chronic absenteeism or something else. And with the work, as much as we can provide students, but I agree with Trustee Chang that it could be really overwhelming to teachers. And so we need to find the ways that we can support them in that, so it's not having to plan 10 days for an individual student over and over. Vice President Blakely.
I agree that we should do the codes. I mean, I don't know if there's the ability to add an extra other category for excused versus unexcused, but whatever flexibility or appropriate modifications that we can make, I would like to make those. And I agree with what people have said is not second guessing parents who keep their kids at home. And as far as the instruction for when kids are quarantining, I agree that we need to try to find some other kinds of solutions. And I think when I had my one-on-one with Dr. Rudolph earlier this week, there was a possibility of leaning on some of the coaches that we have to see if they could come up with some sort of standard plans. And also just reading, get books in kids' hands and have them read. Maybe, write, there could be various writing assignments. What's the main idea? Describe the character that are sort of appropriate for each grade. Obviously, the first graders aren't going to be as complex as the fifth graders, but reading is great. I don't know about the math, but I trust our coaches and think that there's probably some games or even like websites or whatever that could be utilized to help kids, practice their math facts and use some math. It may not be the same thing that's going on in the classroom, but it will keep their brains active and ready to learn when they are back in the classroom.
And then Trustee Berman.
I'm in line with everyone else with A and B, having these absences be excused. I think we have to show a lot of compassion for our parents right now during these really tricky times, and trust them to know what's best for their child. And I think that we should provide some work, and I'm hopeful that I was also thinking about all of the Google Classroom work that's out there, and I hope that we can put that to use. Our kids who used it the last 18 months are just really terrific at it. They know how to navigate all the tools. And I was, when my daughter was out, I was just relieved that she had her math lesson to watch, and she had the page there. So everything just showed up virtually, and she wasn't behind. So that worked out really well. And I agree with Vice President Blakely that if we could figure out some support for our teachers and just some reading at home, I think that would be really helpful in a way to streamline some of the makeup work.
Yeah, even if every wish guidance here, if every teacher at a grade level across the district put up their Google Classroom plans for last year for 1 week, so that everybody got assigned a week, and then you have the entire year covered. If everyone donated 1 or 2 weeks of their Google Classroom planning from last year, we could cover a grade level for the year, that type of thing. All right, next slide, Dr. Rudolph. Vaccination and testing. I am going to make my comment because I've been waiting for this slide for 1.5 years. I think the best and first and most important thing we can do to keep our children safe and other members of our community who cannot be vaccinated. I know we have teachers and staff who for medical reasons cannot be vaccinated and are vulnerable, is to require all of our staff members who are medically able to be vaccinated. I also believe when we have full approval for the children's vaccine, which is going to be, a year from now, it's going to be a long time before that happens, and it's fully approved instead of being emergency use authorization for children. I would like to see us do the same thing, but I think that is a very long time from now. Other trustees, Trustee Chang.
I take a different approach on the first question of a lot of the places that are been, a lot of the health workers have been mandated to get the vaccination. The real details are already what we already do right now. So most hospitals are requiring their staff to be vaccinated, are saying either you vaccinate or you do daily testing, right? So I'm not aware of anyone who is saying, most hospitals are providing those 2 options. And maybe hospitals are saying if you don't vaccinate, you lose your job. But more often from what I'm seeing is they have the plan we have right now. So which means that I feel like we already have a mandate in the sense that if you aren't being vaccinated, you're doing daily testing. And that sounds very safe for our community in the sense that vaccination does not guarantee somebody cannot be a carrier of Delta. And so on the flip side, if we do require, if we already basically have a mandate, but then we go through the rhetoric of a mandate, we could lose staff members. There's an ideology to this and partisanship. We just look at the state and north of us. We can see that. On the second question about for students, I agree with that one. I do agree with President Connolly that we already have the practice of requiring measles and vaccinations in California. And so once it's FDA approved, and I agree, it's not going to be for over a year, emergency authorization will come soon, but then FDA approval, when that comes, this should be a requirement. It's worth our board knowing that that we have no precedent to require vaccination of teachers. California requires childcare workers to be vaccinated for things like measles, and hospital workers and nurses do. But actually across the country, and I'm not defending this, but we do not vaccinate. A lot of parents may not realize there's no vaccination requirement to be a teacher in a classroom in California or other stuff. It's not a requirement. So I think a lot of us go into this thinking, oh, we since as parents we vaccinate our kids, so the teachers should be vaccinated. Requiring teachers to be vaccinated on this would be new because right now teachers are not required to submit any vaccinations.
Is that true, Dr. Rudolph? Because I know I had to submit my vaccination results.
The TB test, but not measles and
we had to undergo background checks as well. Dr. Rudolph, do you know?
Ms. Victor will be able to answer. I know there are certain requirements.
I will say we do regularly update TB tests. And, you know, we collect a lot of information, and we have been collecting all of the vaccine information here. And I actually will come back to you in a moment and look into my systems to see exactly what else we do collect, because I have to verify before I answer your question to tell you if we take all vaccine information for staff. So give me a couple minutes and I'll come right back to you.
I am pretty, I mean, I've worked in quite a few districts around us. I'm pretty confident saying that measles, which we should be worried about, as in, I mean, there's been measles outbreaks in California, and that's a equally really dangerous thing for children and adults. There are TB test is akin to a COVID test, right? It's like, it's not preventing you from getting TB, it just lets you know if you have it. Teachers don't turn in vaccinations. I'm not saying that's a policy decision. I think that the state can look up. I mean, consider changing, but I guess I have kind of already said my part. But thank you.
Thank you, Vice President Blakely.
Regardless of whether there's precedent for it, I'm in favor of requiring it with medical exemptions where appropriate for all teachers and staff. And also, I'd be in favor of requiring it for students too, but as you point out, President Conley, that's probably a little bit further down the road.
Trustee Wheeler.
Yeah, so I agree with Trustee Blakely and Trustee Conley on both of these things. And I haven't read it articulated, but I would respect it. There's also an exemption for religious reasons. So if like teachers or staff, you know, medically cannot get the vaccination, and there's a religious reason, I would respect that, and then have require people to get tested.
Trustee Berman.
I agree with Trustee Wheeler. I feel like, well, I know that vaccinations are our best tool to manage this pandemic, and I want to show that we demonstrate to our community that our school district is committed to vaccinating all of our staff members. And more importantly, I want families to know that when they drop their child off in our care or at school or at the bus stop, that every adult, every staff member that they encounter that day will be vaccinated. And I know that there are school districts that are now coming out in favor of a vaccine mandate for their staff. And I want to make sure that we join them in mandating that for our employees.
Trustee Chang.
I mean, it looks like there's a majority that wants to mandate the vaccines. If that's the direction we go, I would urge the board and the districts look at what are the vaccination rates for other risk factors, other diseases and illnesses that we require students to be vaccinated for, and what are the vaccination rates for those for our staff? Because if we believe as a safety measure that vaccinating our staff is a way to keep our kids safe, there may be others like measles that the board in the future may want to explore.
Yeah, I think that's a separate agenda item, but I understand what you're saying. I do think we only have one virus that's a global pandemic right now and is killing hundreds of thousands of, if not millions of people daily. And so immediate and swift response, I think, is merited. We are not going to get out of this pandemic until everyone who can be vaccinated is vaccinated. And if we can do our part as a school district in helping to push that forward, that is a hill I'm willing to die on, if you will. Dr. Rudolph, is there further guidance you need from us?
Trustee Blakely has her hand up.
Oh, I can't see her. Vice President Blakely.
Thank you. I just concerned about the religious exemptions. My recollection is a few years ago, there were way too many students whose families were requesting religious exemptions for whooping cough. And there were lots and lots of whooping cough outbreaks. And so the state changed that. And I don't know if they removed all religious exemptions, but they certainly tightened it up. And this is something I feel is even more critical to the health of all of our students in our community. And so I would be in favor of limiting, if we were going to offer religious exemptions, to have them be as strict and as limited as legitimate as possible, not just because, you know, a way to get out of it.
Yeah, I absolutely agree with that.
Okay. Trustee Chang, I saw your hand back up.
Just so I can clarify for the staff. So if we want to follow the statutory requirements for children, there are no longer religious exemptions. Like it's nearly impossible to get with the new. So are we saying we should staff should follow the same standards as students? And that would be clean. I mean, it'd be statutorily clean for them to say the expectation is. Is that what we're saying?
I'm in favor of that.
Yep. We have a majority. All right. Further guidance on this, Dr. Rudolph, or?
Nope, I think we're good.
Okay. Should we, before we move on to our next presentation, take a 5-minute bio break and then we will come back? All right, thank you everyone. And thank you to all of the staff. I see we have everybody on here tonight. We will see you back at 8:11. see everyone trickling back. Just one more. All right. We will now move on to item 2B, the fire smoke safety protocols, again with a presentation from Dr. Rudolph.
All right. So now we're going to move on to a response to air quality. We have Ted as well as Jason on here who can provide extra assistance when it comes to the technical aspects of our HVAC system. But really our goal here is to really develop a sort of a set up a clear guidelines on how we can deal with the increased risks that are associated with fire season. We also want to be clear that we're using professionally monitored systems and guidance that's recommended by CDE, CSBA, AXA, Santa Clara Department of Public Health, and Santa Clara County of Education. This has been, one thing I'll say is we anticipated plan for scenarios. This is also information that continues to change and sort of evolve. Most of the guidance that we got actually comes before COVID, but as fire season is picking up, you're starting to see more guidance that is sort of revitalized. And I know President Conley actually just sent something that talked about the metals that you can sort of inhale as a result of the forest fires or wildfires too. So it's a lot of information that we have to take in, but ultimately we're trying to provide parents with some scenarios that are specific, that provide more clear guidelines and assurances about what's going to come next. So first one is how do we monitor air systems? First, we use airnow.gov to determine the appropriate course of action. They actually they are beta testing a fire monitor that utilizes Brizo, Purple Air, and sort of individually monitored systems. But ultimately, the airnow.gov is the most I wouldn't say the most accurate, but it's a professionally monitored and calibrated system that aligns with EPA guidelines, both California EPA as well as the federal EPA. Our secondary system is the Bay Area Quality Management District. It's been around since 1955. It has more monitors, and both of these systems have predictive capabilities, which is really helps families to sort of make a determination about what next year, tomorrow's going to look like. Systems like Brizo, which you can find incorporated in your phone. Purple Air requires additional modifications to create an accurate reading that is really reflective of the US EPA standards. It's not that Purple Air can't, it's just that it requires a little bit more work to get there. So yes, airnow.gov uses some professionally monitored systems. Those sensors are not necessarily located within Mountain View. That does not mean that they're any less accurate, but it's just to note that they have 4 within our general area, and then there's more when you go to the East Bay. If we look at the Bay Area Quality Management District, you see that there are actually more. The closest one being the Palo Alto Airport, and the next closest one being San Jose, Jackson Street, and then Redwood City, or sort of right there, right? So definitely more. Again, it's been around for quite some time, and again has predictive capabilities. So again, I want to reiterate, and this is also why we have our engineers as well as our construction management team on there on the call. First one is all of our campuses are utilizing MERV 13. Thanks to board approval, we were able to revamp all of our HVAC systems, except for the newer ones that would have been installed as a result of new construction. And the ones that were just recently installed also have the CO2 filters or the CO2 monitors that sort of help to adjust. But it's all also put on one energy management system, which allows us to control the flushing of of different areas. In addition to that, we are also adding portable HEPA filters to each space. So these have been ordered. They are coming in. It will take a couple of days for our maintenance team to put them together. These have the HEPA filters have a 5-year life, and they will be posted in every single classroom. And then we also are adding in additional fans for larger spaces like the MER, so sort of the helicopter fans. But with that in mind, COVID-19 presents a larger concern in dealing with poor air quality and indoor activities, as was just illustrated just previously about the uncomfort of being outside just because of COVID. Well, what happens when the air quality is bad? And since children fall within the range of sensitive groups, the recommendation would be for them to come inside. So just a couple of things to keep in mind. MER filters capture about approximately 90% of smoke particulates. Smoke particulates are larger than viruses, and they sort of get caught in the filter at a higher rate. Typically, these filters are replaced every 90 days. Obviously, when smoke-related events occur, we have the ability to change them with greater frequency, depending on the location and duration of the event, meaning the fire. These are not deodorizers. So even though we are trapping the particulates in our system and we have the HEPA filter as a secondary, it does not mean that you're not going to smell smoke. And so, it's just something that we need to keep in mind, that kids can report smoke. It does not mean that they are being put into unhealthy positions. So we want to develop an approach for low AQI or high AQI, right? So the benefit of monitoring the AQI is that it allows us, we're basing it off of air now measurements and local conditions, as well as take into account our availability for air filtration and direct observation, right? It allows also of monitoring the AQI using one system. It allows us to announce any closures or moves. And then of course, it takes into account children with respiratory or heart conditions are vulnerable to poor air and may require extra precautions, right? So obviously we are advised, school districts should advise parents to consult with their family healthcare provider. So we've put in, we've been working on a chart that sort of is a little bit different from what we have seen on some different charts. First, because air now has 5 different levels, we also wanted our activity levels to reflect the 5 different levels. We also wanted those color codes to be the same. So we're currently working on sort of synchronizing that. So when you look at an orange level, orange corresponds with it. But right now there are different levels. And so we highlight in this chart the difference between each particular restriction, right? So what happens when you're at a level 1 where it's green, there are no restrictions, but as you move up, it sort of makes a determination about what takes place. And these levels correspond to the AQI. This is a draft of what we are working on, but it's definitely stuff that we want to have that's transparent. So what happens? We are really in unknown territory. As I said before, CDC and EPA guidance for air filtration, which was included, was developed prior to the COVID-19 pandemic. We initially planned on adding bipolar ionization, but that was placed on hold. Both CDE as well as EPA have concern about these types of products, the byproducts from these ionizations. It is brand new technology and more testing is required to understand the impact of the ozone generators. And it's also suggested both by EPA as well as CDE that these technologies are not used while rooms are not occupied. So we purchasing the HEPA filters actually saves us a lot of money compared to the bipolar ionization, and allows us to really, what we're going to do at the next board meeting is come back and ask, DSA has already approved the ability to retrofit some of our newer classrooms that were at first unable to add windows to now add windows. And the cost savings from using bipolar ionization helps to cover the costs for those windows. And then obviously we had funds that we could purchase the HEPA filters, which last for 5 years. So having the MERV 13 plus the HEPA, we feel like is a better alternative, and is also recommended by the Chan School of Public Health, as well as Santa Clara County Department of Public Health too. But we are in a catch-22 when it comes to AQI closures and remaining open, right? So we obviously need to factor in now our ability to reduce the spread of COVID-19, lunchtime being the biggest time, as well as we would have to have indoor recess and some other things. We need to determine whether the quality of our filtration system outperforms the home systems, right? And so there's this big debate about which one's better. And then obviously one of the things I didn't put on here is that you also have to take into account what happens to the transportation, right? So kids who walk to school, kids who are being driven to school, kids who actually catch the bus. What is the impact of having them outside in poor air quality? I think it was earlier this week, Tahoe, which is experiencing 2 fires, was at 798 AQI. And so obviously that's not an environment that you want to have your kids in, but it is a possibility. I know last year we hit the 400s a couple times. Obviously poor AQI requires more indoor activities, which of course could lead to greater spread. And the current state guidance is that school districts should start considering closure once your purple AQI is either at 201 or above. We're not looking for a very specific number, but we are looking for guidance in terms of what happens if we hit the purple tier and sort of understand where the board would like to go. For the most part, most districts try to remain open as much as possible. But I think there are times when the numbers get to a certain point where you have diminishing returns. Some other things to think about: how we monitor air quality is debatable. I know a lot of people like purple air. Breezo is pretty easy too. They do have more monitors, but when you compare those to air now, there's a lot of adjustments that need to be made, and there's a lot of you have to also remove the indoor filters from the indoor sensors from outdoor. I know the other day I was on purple air, and there was one sensor in Mountain View that was at 1600 AQI. But once I removed it from the because it was an indoor filter, once I removed it, it then changed. And I think that's part of the challenge that we have when we look at those particular sites. And so air now tends to be the gold standard for what we should use, but it doesn't mean that we're not looking at other ones, right? And so this is not something that we want to debate. We know that people feel a certain way about different products, but at the end of the day, we need something that's consistent, and this is the one that the state recommends, as well as Santa Clara County Department of Public Health. I do want to point out that we're not actively monitoring the AQI throughout the day. We're not looking at it hour for hour, minute by minute. In fact, one of the things that when you look at how to adjust purple air or Breezo, they recommend that you turn it to closer to what the US EPA says, which is for it to monitor every hour. But we are looking at it throughout the day and sort of just checking to see where air quality is. But it's not an active monitoring, meaning that every hour on the hour, every 15 minutes, we're trying to see what takes place. It's also important to note that once we are in school, we are in school. And so we're not a large system on the East Coast that has 1,000 buses at its disposal and can bus kids back out. Most of our kids either walk or ride a bike or brought to school. So obviously we want to make sure that we keep kids in once they're here. And then, obviously we'll make on-site adjustments like we always do. If we see the conditioning's worsening. So for instance, we start off in green, which happened last year, and we weren't in school, we were in distance learning, but we start off in green, and then by the end of the day, we may be in the orange. Then it's definitely something that we would say, well, we're going to move to indoors. But we want to make sure that we are, if conditions are worsening, we'll make on-site adjustments as appropriate. But we do need some particular guidance. Again, we have a situation where under normal circumstances, poor AQI is not an excused absence. However, considering COVID-19 and poor AQI, should we explore the possibility of excusing absences? We do anticipate that parents will actively monitor the AQI and will make determinations either at the beginning of the day or during the day about whether or not they want their kids to be in school. The second one is do the actions in the chart align with sort of the board's direction? Specifically, when we hit the purple or the highest tier, do we start? There's actually 6 levels, but once you hit purple, you're at the highest level. Is that when we want to start the conversation around the possibility of closures? Which AQI level would lead to the discussion of closures? For instance, at 201, the state says that we should start considering it. Or is it that if you hit the red tier, which is a little bit higher, or level 6, that's where you want to go? And then the last question that staff has is, does the board have additional considerations for actions that we should take into account? Obviously, our goal is to take your guidance today and to meet with some groups and then come back with some clear guidance about what that looks like. We do understand that while we're being preemptive about this, at the same time, fire season is already upon us. And so it is possible that, some of our decisions will come, some of the decisions we may have to make may come at the exact same time that we're finishing this up. But I do want to remind people, a couple of years ago when we did close schools because of that poor AQI, that was actually in November when that took place.
Thank you, Dr. Riva. I have a question before we kind of dive in on lots of questions, and it's about the chart that was specifically chosen for the presentation. So we know that the AQI levels actually have 6 levels, and they use terminology like hazardous, unhealthy, and healthy for sensitive individuals. This chart came from a piece of guidance that was put out by sort of a collective of organizations endorsing it. So CSBA, ASA, it came from the CDE as well. And it is the oddest chart to me because it doesn't actually use air quality levels. It redefined, instead of having sensitive groups, which every other AQI chart talks about, sensitive groups, which include children under the age of 18, are automatically part of the sensitive groups. This chart says sensitive individuals, and then it defines sensitive individuals as those with asthma or other heart or lung conditions, which is different than every other format I've seen it in. And so I kind of worry that this chart came from too many different organizations watering down what is actually put forward by the EPA when the EPA speaks for itself, or the County Office of Education when the County Office of Education speaks for itself. So I'm hoping trustees will also look at the California Environmental Protection Agency's guidance for schools. That came out in December of 2019. This chart from the kind of CDE came out in July of 2019, so earlier than that. And the California EPA guidance is from their Office of Environmental Health Hazard Assessment. So I'm really interested in talking about actual air quality levels and not just renaming colors levels and using the terminology that's being used by the EPA and other organizations.
Yep. I just want to point out, this is just an example. What we like about this one is that it calls out specific activities. So our goal is, to really bridge all of that together to create, to make, because the colors actually don't even match either. So to make the colors match, to put all the information up at the top. But we did like the fact that it calls out recess, it calls out after school activities. And so we would bridge all of this information together and sort of create something that's a little bit more inclusive of the different types of guidance. But, we're pulling 2 presentations together. So this one, we grabbed the quickest example that we could as just a a starting point for the conversation, but our goal is to bring something back that's a little bit more reflective of what you're saying. Plus, it also reflects the 6 levels on airnow.gov versus the 5 levels that's on this.
It took me about 10 hours to find on the County Office of Education website. They have a similar chart that they did in 2018 when we had school closures for the first time in relation to smoke. And it talks about recess, lunch, PE, all of these things, but with the actual AQI measures. So I sent that out at the last hour right before this meeting once I found it, but I don't know if you could screen share that or if I could screen share that so that trustees can also see that if they have questions, or I can email it to trustees.
Well, I'll say I'm interested in seeing that, and that coordinates with a comment or a question I sent to Dr. Rudolph earlier today is please add lunch to this chart. So I'd like to see what your chart says about lunch, Devin.
Okay, I'm sending it now. Trustee Berman.
So with our updated HVAC systems and our MERV 13 filters and the soon coming HEPA filters, what is our ability to keep our learning environment safe from smoke and COVID when we reach an AQI level of about 150 to 200? So right when we're in that red range, I'm hoping that this is a positive response, that we're able to strike that balance where we can keep a healthy learning environment for our kids when they're inside learning at those levels. Do we know the answer to that?
Yep. So I would say our ability is safe, but I want to defer to Ted and Jason and looks like also John to also answer that question, because they're the people who helped to create the system.
Right, and I also just want to point out that I think it's amazing that our schools have all of this new technology, these updated HVAC systems. I know that there are so many buildings across our state and across our country that don't have this for their students. So I feel so fortunate that we're in the position that we're in.
Okay, thank you, Dr. Rudolph. So I'd probably want to turn that over to John. As you said in your presentation, the MERV 13 takes out about 90% of the particulates from smoke. The kind of counteracting that with COVID. With COVID, you want as much outside air as possible, or more outside air. With wildfire smoke, you don't want to bring in more outside air. You want to run through the filtration system. So again, 90% of that particulate is picked up by the MERV 13, provided it's new and clean and changed. But John probably has a little bit more information on the extraction of the filters and the wildfire smoke.
Yeah, so yeah, it will filter out the particles, but then in terms of smells and smoke, it doesn't have that ability unless you put in carbon filters, things like that can remove smell. So I don't know if it's an option, but then the district does have an energy management system which can modulate how much outside air you can bring in. So you can, during a fire season, you could control the damper to close it, fully close it, so that you can bring in all this smoke into the classrooms. That could be one option.
But it's my understanding we don't want to close the dampers during COVID.
Right. So that
open.
Right. So it's a give and take, right? So it can filter out the particles, but then it won't remove smoke. So if that's okay with you, then obviously you want to bring in more outside air because of, the virus and all that. But again, you will smell the smoke. One good thing about the GPS system is that it will remove the smoke. But again, that system is being opted out right now. So.
Okay.
Vice President Blakely.
So it is possible to keep the dampers open, so like not put it on recirculate essentially, and it will filter out those particles, and it will also filter out internally the COVID. So we can't do that. It'll just smell, it, you know, the air will be fragrant, but it won't be as harmful.
Right, correct.
Okay.
And I'll just say, I mean, it's filtering out at an efficacy rate of, I think that stat was 90%. So
right.
There's still, it doesn't get everything because the range of smoke particles are different sizes, and the efficacy of the MERV-13 filters is greater at a higher particle size, but it's still highly effective.
Thank you.
Trustee Chang?
Would there be an impact on the longevity of the filters if we run them to filter outside air during fire season?
Yeah, so you want to replace it more often if during that time.
Is it within practical, like is the frequency something we can still handle? Like so if we do need to change our filters more frequently for them to remain effective, is that something we're equipped to do?
That's a district question, I guess. It depends on how much stock you have, right?
To answer, yes, we can.
Vice President Blakely.
So it seems to me, and I guess I'll pose this as a question, that the kids are probably safer in a classroom environment breathing this filtered air, even if we keep the dampers open during, like, let's say it's 250, than they would be in most schools. Is that true?
That is correct. So if the air quality outside is not that good, you want to keep the kids inside.
And it would be better inside in the school filtered system than the average household that doesn't have a filtration system.
Right.
Okay, thank you.
Trustee Chang.
And this question we may actually need a medical expert to answer, but like it's my understanding that like a lot of the metals that are in fires are so small, the way that they pass, like even at like these filters don't usually pick up those. I mean, that's why the same reason they don't pick up the smell of smoke. But what I don't know is usually these fires are quite far away, right? So it's like you know, so since they're usually in the distance, do we have that concern about heavy metals and like you know, because the research on the dangers, the long-term dangers to children on that is quite alarming on when it comes to metals and fires. And the small particulates too.
So we have that table about how efficient that MERV-13 filter is. Let me see. So it depends on how small the particle is. MERV-13 can be 50% effective in the range of 0.3 to 1 micron, and up to 90% effective between 3 to 10 micron.
I think what you're asking, though, correct me if I'm wrong, Trustee Chang, is like what the heavy metal portion, which are usually in those smaller particles, if the kind of travel rate of that, so to speak, goes down over time. I don't know, John, I don't know if you know that either. That might be something to consult with either different fire experts or health professionals. But like John said, the efficacy rate of the MERV-13 filter still has some, it filters out some amount of those. And like Trustee Blakely referenced, it might be more than other environments in which people might be in.
We're also planning HEPA filters in every single classroom as well that are overrated for the space that they're located in. But there was research that came out this summer. You can find it from the California Air Resources Board that's showing, they were looking at the campfire in particular, but they're finding lead in wildfire smoke, which is one thing that we know is never good for children to be exposed to. And they found huge amounts of it in Chico because of how the winds carried it. So it can travel very far distances from the site of the fire itself. They also found significant amounts in San Jose. So it is something that I agree, Trustee Chang, we need to be concerned about and paying attention to. Whether or not our systems are better than what children experience at home, I think is really dependent on families and what their home situation is like. So there are students for whom a home environment may be very unhealthy during a fire season, and students whose home environment may be safer during fire season. Trustee Chang.
I'm trying to get a sense of, there was a kind of question about, do we at some point turn to recirculation or not? And is it being the advice of our experts in the room that is unnecessary for us to go to circulation, that we should keep it on outside air because the filtration, is that what's being recommended to us?
Right. So that's what I'm saying. If the if the air outside is clean, you will bring in the outside air. But if the quality of air is not that good outside, you have the ability to close the damper and recirculate all the air. All this air is still being filtered. So it will be better for the interior environment, right? If you don't bring in a contaminated outside air.
But is there a recommendation? Because at some point I feel like the board will need to kind of weigh in on this, right? Like, do we keep it as outside air because it's helpful for COVID, or do we go circulate? And I haven't heard kind of like a recommendation to us on which way to go from the experts.
There are recommendations from, so for example, from the California EPA, they talk about having HEPA air cleaners and air cleaning devices when the AQI is over 100 and not bringing in outside air. So, whether or not we weigh that against COVID is, I don't think actually our board is qualified to make that choice. We are not medical experts and we don't have medical experts here. But if it's purely based on the smoke exposure, the County Office of Ed, the California EPA, they all say that at 100 and above, you close everything up and you seal it off. Go ahead, Trustee Chang.
I mean, given that the number of days above 100, we know and because of COVID as well, we know that we can't do that level. And I know that of course, I agree that we don't have the medical staff here to advise us at this moment, but then the district doesn't need to make a decision, right? So someone has to make a call on, and I guess we could wait for the county, or on when do we exercise that mechanical switch to go to inside air, if at all.
I mean, the county guidance is still at orange, that at 100 that you close everything up. I don't know if we want to buck that, but that's what the 2018 guidance that I just sent to everyone shows.
Because that's quite a few days, right? Like the number of days between 100 and 200 AQI. And it's something these are trade-offs, and I know we don't have a full expertise panel here to help us, but parents are relying on us. I guess the default is we don't do anything, right? The default is outdoor air filtered, which it sounds like from the staff that is quite safe, but
if it helps, today in a county meeting, they suggested when we hit an AQI of 101 is when we would shut doors and windows.
So that's consistent with the 2018 guidance they put out. Trustee Wheeler.
Yeah, so this is a question for Superintendent Rudolph, not for our experts here, but when we closed schools last November, what was the score, the air quality score that was in existence then that we chose to close schools for?
So I think that was 2018. And I want to say we were in the 300s. Wow. Is when we finally made the decision. But I don't remember I even tried to look back at the letters that we sent out and was unable to find the level. Trustee
I sifted through my emails, and on November 15th, 2018, we were getting emails that said, it's 220, please close it. And I think my recollection is we were sitting in the Graham MUR and it was around 250. And we took our little bio break or whatever, and we're like, we can't breathe in here. We gotta close schools. And I also recall that the superintendent was of the county was pretty upset with us for doing that. But I know a number of other districts did choose to do the same. And I think it went up through the course of the evening and went above 300. But when we made the decision, I think it was around 250.
The county guidance then, or it may have come out shortly after that, I don't know when in 2018 this was put out, said that at 275 that you close was what they were issuing at that point. Trustee Berman.
So I participated over the weekend with this presentation with Senator Josh Becker's office around ensuring healthy air at schools. And I was hopeful that we could stay in person at a higher AQI, because the recommendation was keeping it at 15 CFMs per person, and there would be an ability to keep it open so that we could do some recirculating, because we have the MERV 13 filters and the HEPA filters. And the recommendation was that, you could keep going at rates, at around 200. And what she had on her slide was 250, consider closing schools. So, now we're sort of thinking about 100, and it just really makes me concerned. Would 100 sort of closing up, are we implying that would mean that we'd have to close our classroom?
No, 100. Sorry, 100 is only to close the doors and the windows.
Okay.
But we would still be running, and then that would also trigger indoor lunches, indoor recess. So it triggers different activities. It wouldn't be we close school at 100.
I guess at that point you think of, okay, I need to have confidence in the recirculate, whatever the filters that we have and how effective those are. And I think back to unmasking and eating indoors, and what our plan is going to be if we have strong feelings around if we believe strongly that kids shouldn't be unmasked and eating and within 6 feet of each other, and what a high risk that could be, what that's going to look like at our school sites, and what sort of clever planning we're going to have to do, not just for days like this, but also for rainy days. We hope for rain, I think. But I think we'll probably need a similar plan if we want to make sure that we can accommodate that feeding schedule under those constraints.
Should we take public comment, trustees?
Yes.
Okay. If you are a member of the public and you would like to comment on this item, you can raise your hand in Zoom. I do see we have Mr. Nelson. If anyone else would like to raise your hand, you can use the raise hand function, or you can press *9 on your phone.
And then Trustee Connolly, we received public comment.
Yes, but all trustees have that to read. We are not reading the public comments out loud in meetings. We changed that policy in January. So all the trustees received it well ahead of the meeting. And I am assuming everyone read it. All right, it looks like we have 2 members of the public to comment. You will each have 3 minutes. We will start with Mr. Nelson. You may press *6 to well, hold on just a moment. Let's get your timer up. All right, your timer is ready. You may press *6 to unmute yourself, Mr. Nelson.
Am I unmuted now?
Yes.
Okay. Board of Trustees, point number 1. I'm only talking about smoke because the 2 things are different. Checklist certification on the uninstalled bipolar units. Point number 2, hold off on small floor filter fans because Harvard's ventilation advice is they're not needed for M13 recirculation system. Point 3, buy 1 portable ozone detector and a PM 2.5 purple air monitor for inside smoke monitoring. Number 4, install the option recommended by our HVAC contractor specialist, John, for smoke, bipolar. Let the science work. As the CDE recommended in your materials, please look at these decisions, school sites, and order of installations using, quote, an equity lens. Socioeconomic disadvantaged families may not have options for alternative childcare if you close down a school. Working parents or guardians are disproportionately affected by school closure when they're poor. Students receiving free or reduced price meals may not have a reliable alternative source. And instructional time for the kids that are 1, 2, and 3 years behind time, closing a school and not having school for 2 weeks is really bad for them, for their catching up. The EPA recommends UL 2998 certification for bipolar ionization devices, not ozone generators. These two are very, very different. Zero ozone is the underwriter's lab metric, plus or minus parts per billion, or the California Air Resources Board. Certificated air cleaners, not ozone generators. The California board certification is, quote, based on devices, low, usually zero ozone emissions. Don't let poor science scare you. 5 parts per billion or less of ozone to reduce smoke from outside HVAC air exchanges is not a poor trade-off. Like vaccination to reduce classroom smoke, you can have these things work only during the time when there's a smoke event. A 13A filters are recommended in air recirculating HVAC systems. It is much better than the small 4-flan filters with low clean air delivery rates. Those are small add-ons, sort of like, just like floor heaters or an add-on to a robust HVAC system. On page.
Thank you, Mr. Nelson. Please feel free to email the rest of your comments to the board as well. Alvaro, you have 3 minutes. You may unmute yourself.
Hi. Well, let me start with a little thing that I forgot earlier, and I think it's important. As thank you, Superintendent Rudolph, because the presentations I think have been very detailed and carefully put together, and I know that there's a lot of work in there. So I want to, in spite of all my comments, that has to be said first. I just wanted to stress that, or let me put it a different way. I think. We've been listening and we still, I think, get a little bit of mixed signals about what's going to happen when there's smoke around the lunch for kids and masking. So I think I heard in the last couple of minutes of the presentation that when we get to 100, or maybe it was the comments, that when we get to 100, we might move activities indoors, and that includes lunch. And honestly, I mean, the guidance that I could see on the tables that you have presented, both of them, seem to contradict that. So most recommendations that I've read speak of physical activity, so say PE, the kids running around during recess, etc., when the numbers are high. But just being outside for a few minutes for lunch is not kind of that's not the sort of recommendation that these tables are referring to. So we have to compromise here with these two opposite directions. I honestly, I think 100 to move the kids indoor in their classrooms without a mask to have lunch, or just, you can imagine all those kids yelling. It's just not a good idea. I think we should allow for an option for parents who think that, it's okay for their kids to be outside, have quick lunch, and then go back in, and provide options for, because everyone's going to have, I suppose, a different threshold of what they consider safe to their kids. But these are not normal times. And hopefully in a few months we'll be out of this and we will all be in a simpler situation. Anyways, that's my comment. Thank you.
Thank you very much. Dr. Rudolph, I have a question. Are we required to, at a minimum, follow the county guidelines? Or are we not required to follow the county guidelines? I'm unclear on that.
So we can choose to follow or not follow. We have to, if we close schools, we have to apply through the state, and you simply have to get sort of I think the county sort of acknowledges or sort of writes off that it's happened. Last time when we did it, they expressed their displeasure, but they didn't necessarily stop it because you're applying for a state waiver. And of course it was approved. But it doesn't necessarily mean that that's what we have to do. And I think that's part of the reason why we wanted to have this conversation. It's just to figure out sort of where the board stands and to give us guidance about what comes next.
I guess then let me rephrase it. I'm sure we can be more restrictive than the county. Are we actually allowed to be less restrictive than the county?
Depends on what less restrictive is. I mean, ultimately, you could say, we really feel comfortable that 100 AQI isn't really something to be worried about. And I mean, you could go with that remark. You could say, while we may do physical activities indoors, we'll have lunch outdoors, if possible, depending on the site and the ability to do that. I mean, there's a lot of different variations for it. So I don't know if there's not really much guidance. There's just a lot of recommendations, and you're not really required to at this particular level. I think where the concern will be is if you close school at an extremely low level, I think that's where you start running into an issue. But any of the other activities, I don't know if that's really going to make a difference in the county's eyes. It's really about the closure that's going to ruffle their feathers depending on where the level is.
Okay, because on the guidance they have, it says for 100, that's on-campus indoor lunch is strongly recommended for high school students, but mandatory for elementary and middle schools. And that mandatory word is sticking in my brain.
Well, that's because elementary kids are considered sensitive groups. Children are considered sensitive. And so once you hit 100, it recommends that they have very limited outdoor activities or prolonged, I guess depending on which guidance you look at, right, it'll say prolonged exposure. And so I think that's why they're saying just having children indoors. Okay.
And for trustees, the spreadsheet that Trustee Chang referenced earlier in the meeting. So part of my coping mechanism for uncertainty is to make spreadsheets. So I made a spreadsheet for the Santa Clara County School Board Association of all the different mitigation measures, including what do you do when the AQI goes up, to circulate and find out from other districts what they're doing. So one thing that I saw in there around AQI that a couple of districts are doing, the Cupertino School District, they're following the county guidelines for cut points, and above 100, they are rotating kids outdoors to eat for 15 minutes and then unmasked, and then having the rest of their lunch recess indoors with masks on. And there's, I think, another district in here that made a similar, oh, maybe it's just Cupertino. But so there are ideas out there about different ways to do that as well. Comments, Trustee Chang.
Thank you for sharing that, because I think that Cupertino model sounds like a really practical model. I mean, we're weighing this like a risk of getting COVID versus a guaranteed exposure to toxins and smoke, right? And all of these are impacted by exposure length. And if Cupertino's model of spending a limited time outside to eat and then the rest of the time indoors sounds practical. I would also encourage us to figure out some way where we can really clearly communicate what is the district policy at each AQI, so that families can make a decision if they plan to not send their students to school, right? So like, I think it's too onerous for like site levels to, I think anyone's equipped to like each time the AQI changes to make a decision. But if there was just a chart, right? A chart that families can see that say, okay, when this hits this AQI, this is what school you're going to be eating inside. And then, so the families, if that's just a chart, then families can look at their own weather reports and decide, you know what, I don't want my child to eat inside. I personally hope that we do the Cupertino model and then the kids are not eating inside. The the guidance provided to us on non-eating situations of just closing the doors and the filtration, I felt assured by that. I felt more comfortable by that. It reminded me kind of an airplane, right? And you're in an airplane, you're in a filtered air environment, closed off from the world. And so I feel that in order to prevent the kids from getting smoke inhalation and knowing that that is a guaranteed exposure to all students, closing the doors and using the filter with their mask on, I think is a good balance of the smoke and COVID. But I think the balance shifts if we're saying they're going to take their mask off indoors. I would also urge the district to consider if we are going to close the doors in a smoke situation, that we also consider providing guidance on that, what kind of activities can happen indoors. There's a lot of research around what type of talking students do that expand, or also for teachers, that dramatically changes the expelling of anything that may have COVID, whether it be singing or shouting or even talking loudly, or even like high physical activity in class. So I think that if we are in a situation where we had to close the doors, I think that also means that we're doing quiet activities, that like we should be telling teachers, okay, this is a calm situation. We're not going to be doing big debates or big movements that increase people's respiratory rates, because that exponentially changes what's going on inside. And just the last thing about mask, I saw the district put some mask CDC guidance on mask on there. I'm still a little, I'm worried that our district FAQ says that students should not wear KN95 and 95 mask. I feel like those are legacies from when there was a shortage. I mean, Office Depot now sells N95 masks, and I do recognize that N95 masks are not typically sized for students, and the fact that N95 masks go over your head with bands are not convenient for kids to put on. But KN95, KF94s, those are like, many families are buying those for their kids and quite happily. And it's really those masks that do provide one additional layer, not just to COVID, but to smoke, because cloth masks don't. The thing that was most troubling on the FAQ that's on the district website, the attachment from the CDC, is the CDC document says that you can wear a gaiter as long as you double fold it. And like, if you talk to any respiratory expert, or if you just buy a gaiter yourself, I have a gaiter right here. We used to use these, and you can double or triple fold this. It is so porous. This is not a good safety measure. I would actually wish that we as a district not post anything that says you can use these, and actually don't let kids use these, because this is not safe in school, no matter how many times you put it around and fold it. It's just the fabric is too open. And so I think that, I trust the expertise in saying that we can go to in circulation. I just wish that we de-escalate the activity we do in there and let be clear to the parents, and that I hope that we can take down the guidance to parents about not using KN95 or KF94 mask. I think that's confusing to families, that we keep that up there.
Trustee Berman.
So I was looking at this spreadsheet, and it's interesting because it says for recess and lunch, when you're at 101 to 150, to mandatory for eating lunch is mandatory for elementary and middle school to eat inside, is what I'm assuming it means. But then for physical education, you should reduce vigorous exercise to 30 minutes per hour. So it's interesting. I feel like there's it's just like conflicting information. Like, you can't sit and eat outside for a little bit, but you can do your vigorous exercise for 30 minutes. So for me, it's really conflicting. I would really like to see our kids eating outside. I think the majority of our kids could eat outside for those 13, 15 minutes. And then, if that's the only time they spend outside, then it would keep us from having to do this. I think it's going to be a really intense plan on rainy days and days when we have a higher AQI, to try to have that distance and mask off to eat. So, but I know that we have students out there that wouldn't be able to tolerate that, that are more sensitive than in our elementary students that perhaps have asthma, have other respiratory illnesses, that would need to be inside at those numbers. So I wonder if those are students that we can identify. Parents can let their schools know that those students need to eat inside, and hopefully in that space, there's that preference for 6 feet. And if parents have a preference for keeping them at home, then we let them exercise that preference.
Vice President Blakely.
I agree with Trustee Chang and Trustee Berman about, to the extent we can have a short lunch break outdoors when it's like 100 to 150, in order to protect against COVID. It's such a balancing thing right now between COVID and smoke and COVID and smoke. And I think whatever rules we come up with now, I would really like to revisit them, hopefully once the student population can get vaccinated, because I think then we could just focus on the smoke a lot more. But I'm looking at the chart that was in the materials, and it's got the level 1, level 2, level 3. And for level 3, which I think is 100, from what I looked up from the air now, 100 to 150, it's got, and then level 4 is 150 to 200. Level 4, it says, reduce vigorous exercise to 30 minutes of practice time for athletic practice. Well, I think if it's over 150, they shouldn't be practicing outdoors. I mean, I know last year when it was over 150, I was trying to walk and kept trying to wait for it to go under 150, and it would just hurt my lungs, and I'm not a sensitive individual. So I really think we should severely curtail any kind of vigorous outdoor activity at 150, and maybe that's a lower threshold, but I don't think we should be having vigorous activity above 150. And then in terms of closing schools, the decision that we made in 2018 to close the schools, we did not have those MERV 13 filters then. We didn't have the HEPA filters. So it was a quite different environment in the classroom. And I mean, personally, I think I would love to come and sit in a class on the super smoky days, because I know that that is going to be much better than what I have in my household. So I don't know that I would have made the decision to close the schools at 200. And it sounds like that's what the county guidance is now saying. School districts may consider school closures based on site-by-site concerns when it hits 200. And, you know, yeah, maybe we should consider it, but I kind of think that the environment in the classrooms is probably going to be safer than the environment in many, many households, not all. And to the equity concerns, the whole reason that the county didn't want us to close was precisely for equity reasons. I think it was more, in particular, what was articulated at the time was the access to school lunches. So that is, you know, a big consideration. And I think, yeah, and in addition to the fact that many people's home systems are going to be less good than our classrooms with the MERV 13 filters. So I'd kind of like to nudge that a little higher before we close, like maybe go to 250, because I think that it's relatively safe in the classrooms. But I do hear what you said, Dr. Rudolph, about, well, if you've got to go outside to get to school, you're breathing air there, and then you have to go outside to get home and you're breathing more air. But I still think all in all, and I'm not a medical expert, so I would trust experts' advice on this, but it seems that if you're going to be in a relatively good filtered environment for 6 hours, that's probably better than being at home in a really, you know, minimally filtered environment. So those are my thoughts. I don't know if that answered all the things you were looking for guidance on.
Thank you, Vice President Blakely. I would like to point out that when kids are at school, there are not bathrooms in their classrooms. So they're walking outside to go to the bathroom. They're walking outside to get their lunches. So they aren't, they're walking outside to go to the library. They aren't completely in their classrooms the whole time, but it is most of the day. Trustee Wheeler.
Yeah, I wanted to comment or second what Trustee Blakely said about it's probably safer in the classrooms with filters that we have bought than it is in many of our homes. And, you know, to the point, I'm not thinking so much about food because everybody's getting food now, but to the point of trying to keep children from missing education. every day is precious. So, I'd like to be able to keep kids in school as much as we can. I would like a number that we decide or choose, or Superintendent Rudolph, assigns, that, people would know, what's going to happen with this number, that number, that kind of thing. And I don't know if at this point we're answering all the questions of the needed guidance. But I have the same opinion about this as I did about, the other question, which is my preference is to believe the parents, to trust the parents. And if a parent feels like their child should stay home, they should stay home. And, if we can, try to navigate the legislature about that too. I imagine a lot of the school districts that are living with, the horrible wildfire smoke are dealing with this all the time. And they're, trying to keep up their attendance, or, not get dinged by the state, but there should be some exceptions. So that's what I would say. I don't know where I am on, do the actions in the chart align with the board's direction? I could go along with what everybody else is saying. But I do think, like I said earlier, I interjected, I see this and lunch as being similar. Everybody's talking about the catch-22 about COVID versus wildfires and inside or outside. So that's where I see lunch and recess being the same.
So I'll throw my 2 cents in. I'm really comfortable with the county guidelines that we have. It talks about closing schools at 275, for example, which, given the filtration systems we're going to have in terms of air quality for kids, I think that makes a lot of sense, especially where we are now. What I would like to see, the one modification I would make to the county chart might be an exemption around that outdoor lunch, that for 100 to 150, we allow a 15-minute outdoor lunch, and then they go back in with their masks on for the rest of recess. That would be it seems like there's at least 3 other people who agree with that, or yeah. I worry a lot about smoke exposure for children because I've worked with asthmatic students. I have asthma myself. I understand, like, if you can't breathe, you can't breathe, and hospitalizations of children with asthma go up dramatically as we move up the tiers. We could easily have more hospitalizations from asthma and smoke exposure than we would have from COVID. We also know that smoke exposure actually makes individuals more susceptible to catching COVID as well. So I don't want to push it beyond that 100 to 150 moment for eating outside. And I would like us to have this chart that's a clear decision-making chart for families, because there's going to be one set of families who they know their child's medical needs and their child may have asthma, and they will see that, it's predicted to be orange or red the next day, and they're going to keep their kid home because there's a clear medical need. There's also going to be a set of families who are going to be looking for, when are children taking their masks off inside? And they're going to be fine with staying at school all the way until 1:50. But if we have kids come in for lunch at 1:51 and take their masks off to eat inside, there's a set of parents that are going to choose to pull their kids out then as well. So I just want to make sure we give the clearest possible kind of decision matrix to families, and then they can make the best choice for their child. And I think that's a sentiment that other trustees stated as well. And again, an excused absence on smoke days above, when it's 100 or above, and people have to start figuring that out. Or maybe, do we want to set the level at which that excused absence would happen, trustees, or no? I don't know.
Well, I was thinking potentially 150. I mean, it could be 101, 150, and that's if someone doesn't feel comfortable having their child, their sensitive child or asthmatic child sitting indoors for eating, potentially, because if we know if their child is sensitive, then they have to eat indoors.
Right.
They have to eat in, that part might make them uncomfortable, right? But we are giving an accommodation, so it would be, if families were okay with it, then we could go all the way to 150.
Trustee Chang.
One way, if we didn't do AQI, could we just make smoke a category? Like, so families can decide what AQI that means. Like, so rather than us set, it's kind of like a fever, right? Like every family kind of has a slightly different thing of like what temperature they send their kids in before COVID, right? Any temperature, you should stay home now. But then like, I think that if we just say smoke is a category as an excused absence, what do people think of that and not set something at all?
I'm fine with that, but if we need to revisit it, Dr. Rudolph, I think we can revisit it too. Part of this is an experiment this year to see how it goes, right?
Yeah, we can bring some stuff back and with some clearer stuff and give us a little bit to work with this. I think we got enough guidance, and then let us investigate whether or not we can come up with some attendance codes, and then we can go from there and we'll bring it back with sort of a final picture of what this looks like.
Vice President Blakely.
Just gonna say, if we were gonna look at levels, so I'm happy to look at the guidance that's proposed, but 100 seems kind of low. I mean, we would have had a couple of days last week closed already, and there may be a whole lot of days that are 110 or 125. So the 150 number feels a little more like a threshold to me if we're getting that granular.
Trustee Chang.
I was curious on the question of my colleagues about what are people's thoughts of like also mandating restrictions on the kind of activities that kids can do when we have to close the doors, because when kids double the amount they're breathing, it's like having 2 people in the room. So it's like if kids all of a sudden are doing something active, it's like you went from having like 30 people in the room to 60, and I don't know if that's
Trustee Chang,
yeah.
You've never taught kindergarten, my friend. You have never taught kindergarten.
Not as long as you have, but I have.
Well, maybe you have, but I think that we can share with our teachers that the lower key the activities are, the lower the respiration. But I also think, imagine you go home to a house that it's hard to breathe in, and you come to school and you're inside, but it's the first time you can breathe in 24 hours, and you get to see your friends, and you feel safe, and you might express that with your body as a child. I don't want to police that in children if we don't have to.
I feel the same way, Trustee Conley. However, I think Trustee Chang's point is a good one. And so pointing that out to the teachers could be helpful. Like, keep in mind, blah, blah, blah.
Share the information and but not have it be something punitive towards children and restricting their movement. I think.
I think it would. I mean, we're pretty good at managing that, and it somewhat follows our rainy day policies, but we can make some adjustments there. Again, and I think it's already constrained when you try to do PE indoors. So I think the PE teachers, the rhythm and moves, will make the appropriate adjustments based off of that, knowing that we're indoors. But when we come back, we'll come back with some outlines, and we'll make sure we communicate it out to staff too. And I do want to point out, we have a focus group coming up, and we plan on asking them about we have a reopening task force, which we'll talk about. This mainly staff, and then we have a focus group, and so we'll get some more. We'll communicate and get some more thoughts to see if they need something a little bit clearer, so that people won't make that mistake.
And then when should we expect to have this finalized and pushed out for the public, and so parents can understand?
We'll work on it as quickly as possible. We have another meeting next week, so probably I think the only time we won't be meeting is September 2nd. So maybe we can get it by then. We'll try our best. It just depends on what else is on the plate. We have a lot of COVID stuff going out tomorrow in terms of this, just different items. So let me talk with Shelley and Corinne and sort of see what we can pull out. And then obviously I have to meet with Rebecca, Kathy, and Tara and Shelley and sit down and just sort of talk through the AQI levels. And then we'll also vet that out too. So we'll come back and look. We'll come back, give us probably about a week or two, and we'll have something. We understand that this is a pressing issue just because of the fires, the Calder fire plus the Dixie. So we don't want it to be something that we come back in October. So as quickly as I can, I'll get it back to you.
Thank you. We'll clone some staff. Vice President Blakely.
Just wanted to echo the thanks that Trustee Berman and others have given for the work that you and your staff have done, Dr. Rudolph and Shelley and Corinne and everybody. It's really been a lot. And I know on top of this, for our community, you are doing a superintendent's check-in tomorrow, which I think will also be very much appreciated by the community that didn't get a chance to have direct questions answered. So thank you for all of that communication and all of that work. And I hope that it's an investment that leads us well into the rest of the year.
Yeah.
Is there going to be a superintendent check-in tomorrow?
There is. I think last year was an exercise in heroism to see our district leadership and teachers and staff and families, everyone pull together to try and keep our community safe. And I think we all hoped we would be in a different circumstance right now than we are. And everyone is running a little ragged around it. But my goodness, is the work appreciated. Making that spreadsheet and seeing how far out ahead of other districts in the county we were already on our policies and mitigation measures just reminded me what a special district this is and how amazing the work of everyone here is. So thank you. With that note, we will move on to item 3, future board meeting dates. September 2nd is the board retreat. It will begin at 5 p.m. trustees because our facilitator is on the East Coast. It will be virtual. If you're a member of the public and you're wondering what a board retreat is, it's similar to any leadership retreat. We'll do a little bit of team building. We're going to talk about our governance calendar. We're going to talk about how we interact in protocols. It will stream, so there will be a Zoom link and you can join the Zoom link, but it will not be recorded, so it's not going to live on YouTube forever. We will also meet again on September 9th and September 23rd. And Trustee Wheeler.
Yeah, who's attending the board retreat?
All of the trustees, Dr. Rudolph, and our facilitator, Peter Gorman.
Staff.
And other staff? We don't have other staff lined up right now.
Okay.
Yeah, we're going to give them a break. So.
I mean,
I'll convey whatever the thoughts are to them. Guaranteed.
If every department head and principal wanted to know if I'm a east, south, north, or west, they're welcome to come on their own, but I'm not going to require them to be there for that. All right. On that note, at 9:24, we will adjourn this meeting of the Mountain View School Board. Thank you, trustees. Thank you, Dr. Rudolph. Thank you, staff.